issue in our community. From what had essentially been limited to providing shelter beds, we go deeper in providing the social services that so many homeless people need to receive to get back on their feet. We doubled the amount of money that the city was spending on homeless services. We did that using general fund dollars, including the proceeds of the real estate transfer tax, which has been the subject of much discussion in the last 2 years. Last year, we added more money to our budget for homeless services, and this year, before our budget deliberations are done, I expect that that number will go even higher. We've seen some success with these changes. While the total number of homeless people on our streets has not changed a lot in the last 2 years, we do have fewer families on the street. We have fewer veterans on the street. These are good changes, but we still face significant challenges. Affordable housing continues to be a barrier. Unsanctioned encampments have grown in every corner of our city, and homeless individuals have died on our streets, either at the hands of others or as a consequence of a life spent outdoors. These are tragic circumstances. Also, unfortunately, I and I think others have detected more recently a change in the tone of the public discourse around this issue. The collective homeless, and I put that in quotes, are being blamed for issues and ills that really should be owned by our broader society. But the blame is being placed on people who don't necessarily deserve that. What all of this indicates to me is that while we're doing good, we can do good better in this community. And that's why we're here today. Over the course of this meeting and a few others, and I've been hearing different numbers from different people, we haven't set a number of meetings. I think it will be no less than few, and hopefully, or no less than 3, and hopefully no more than 5. But I think fewer is better if we can get the job done with that. Over the course of these meetings, I hope that we can chart a clear path forward that takes full advantage of all the precious resources that we have in this community to devote to this issue. And I hope that we can establish an even stronger collaboration and partnership between the city of Santa Rosa and the county of Sonoma on this issue, along with our nonprofit service providers. Ultimately, I hope to join together with our colleagues at Board of Supervisors so we can all explain to the community how these pieces will fit together and how we'll join forces to make that happen. So let's get started with this today. Just a little housekeeping item. We're set up in this room and in this seating pattern because this is intended to be more of a workshop and a study session than a traditional council meeting. We are happy to have the public participation here today. The way that the agenda is set up is that we will hear from the staff, and the council will be able to ask questions of staff, and we will then take comments from the public. With that, I'm going to hand this over to Kelly McIndoll from our Department of Housing and Community Services, and we'll get started.
Thank you, Mayor. Everyone hear me okay? So good afternoon again. I'm Kelly McIndoll with the City's Department of Housing and Community Services, and I'll be giving a brief presentation on the city's homeless service programs and our efforts to address homelessness in our community. This slide is an overview of the presentation. I'll cover homelessness in Sonoma County, provide a homeless services update, touch on regional collaboration and new initiatives, and close with resources and discussion. So the info on this slide is from our 2016 Sonoma County Homeless Census and Survey. After I go over this, I'll give you some information on the preliminary results of the 2017 homeless count, which were about 29 persons experiencing homelessness in Sonoma County. 2/3 of them are unsheltered. Approximately 1,800 of them are in Santa Rosa. 82% indicated their last permanent residence was in Sonoma County, and 76% claimed affordability as the primary obstacle to obtaining housing, which is no surprise in our community with a tight housing market. And 52% reported a disabling health condition. The 2017 preliminary results came out a few weeks ago. We should have the full report in late June. Between 2016 and 2017, we saw a 2% decrease in homelessness countywide. There were 2,835 people counted during the 2017 count. Something noteworthy to point out is we've seen upwards of a 20% decrease in some of our targeted subpopulations, and these include families, chronically homeless persons, veterans, and youth. And while we've only seen a 2% decrease between 2016 and 2017, since 2011, we've seen a decrease of more than 30%. That count was 4,539 people. I'm going to take you back a couple years here to homeless services in 2015. The city supported 3 core programs. Our budget was approximately $700,000 and included the Samuel L. Jones Hall Homeless Shelter. This shelter is owned by the city and operated by Catholic Charities, provides 138 year-round shelter beds, plus a 50-bed winter shelter program that runs between November and March. The Family Support Center is a 138-bed year-round shelter, also operated by Catholic Charities, and the Homeless Service Center, which is a multi-service day center operated by Catholic Charities as well. Homeless services today, and as the mayor mentioned, we have more than doubled our resources for this effort. We have a current budget of approximately $1.8 million, which supports the core programs that went over in the previous slide, including the winter shelter program, and the HCA Family Fund program, which is operated by Community Action Partnership of Sonoma County and provides household assistance, financial assistance with rent and mortgage payments and security deposits. And both the city and county support the administration of this program. Funds are provided by a very generous anonymous donor. And the HOST program, the Homeless Outreach Services Team program operated by Catholic Charities, started in 2015. This includes the Clean Start mobile bathroom shower trailer, rapid rehousing resources. Council will recall back in February committing an additional $125,000 for rapid rehousing. And the Palms Inn, there are 44 dedicated host units at this property. I also want to mention the Community Homeless Assistance Program, which we call CHAP. This allows for the provision of services on private property, both commercial and meeting facility sites. Moving forward, in January, Council adopted a Housing First strategy, and we are trying to balance that approach with the immediate need of so many people living on our streets. The core components of the Housing First strategy include street outreach and engagement, coordinated entry, and housing and support services. Also want to make note of the special meetings, that this is the first in a series of meetings dedicated to the subject of homelessness. This slide provides you a visual of Housing First. So Housing First equals permanent housing and supportive services. It's an evidence-based approach. It prioritizes the provision of permanent housing as the primary strategy for ending homelessness and aligns with federal and state policy. I'm going to cover regional collaboration and new initiatives. So the Sonoma County Continuum of Care, the city holds a seat on the board of the Continuum of Care, which is a regional planning group. I would say now more than ever, the city is collaborating with its partners, the county and service providers. We recognize that we can't do this alone, and this partnership and collaboration is required. A communication plan, in partnership with our fabulous community engagement team, we're developing a communication plan. We're trying to be more proactive about messaging our efforts around this issue. These include having this meeting, the letter that the mayor sent out to the community. We've launched a new webpage called Homelessness Solutions, which I'll go over in the next slide. I also want to point out the recent Housing Authority actions. Our Housing Authority incorporating language into their notebooks, notice of funding availability, requiring that units be set aside for households experiencing homelessness. And we're reaching out to our borrowers, asking them to consider creating a preference on their waiting list for households experiencing homelessness. Before I close the presentation, I just wanted to go over a few resources. We have our homeless services page. So if you want to learn more about the programs the city is supporting, please check out this page. There are also resources there for persons experiencing homelessness in our community, and the newly launched Homelessness Solutions page. Also, if you want to make a referral to the host program, here is the response line and their email. Here is a picture of our mobile bathroom shower trailer called Clean Start, which is run through our host program. And this concludes my presentation. Thank you.
Before we go any further, I'd like the members of the public to know who is sitting around this table. So if we can just go around and introduce ourselves, that would be helpful. I'm Chris Corsi, I'm the mayor.
Jack Tibbetts, I'm the vice mayor.
Councilmember Ernest Oliver.
Daisy Gomez, city clerk.
Sean McGlynn, city manager.
Sue Gallagher, city attorney. I'm Karen Pease, the director of mechanical services. Marvin Robinson, the director of health services for the county.
I'm Mike Kennedy, and I'm the Director of Behavioral Health Services. That's mental health and substance use treatment services, and I work for the health department as well.
David Cook, chief probation officer.
Margaret Van Lee, executive director of the Sonoma County Community Development Commission. Jenny Abramson, homeless and community services manager for the Community Development Commission.
David Wine, Director of Housing and Community Services for the City of Santa Rosa.
Chris Rogers, of the city council.
Julie Combs, Santa Rosa City Council.
Thank you.
So very quickly, council members, staff, members, there's a capacity of the mics, so when you're not speaking, please turn off the mics. This will ensure that everybody's mics works. Thank you for that technical input.
Thank you, and sorry about that, Barbara.
So in wrapping up my presentation, I apologize. I realized I missed two key points on this slide. So I went over the housing authority actions. I want to point out that we're in the process of developing a comprehensive plan for encampments citywide. This is a pilot program. We're looking at encampments of size larger, 10 or more, with the greatest health and safety risks and needs, and looking at both the risks to the individuals living in these camps as well as the broader community, and also looking at additional shelter, expanding shelter capacity possibly at Sam Jones Hall. And that concludes my presentation.
Thank you. Start with the council. Are there any questions for Kelly? All right. Any questions from our county guests for Kelly? All right. I'd like to welcome Margaret Van Lee, the Executive Director of the Sonoma County Community Development Commission.
Thank you very much, Mr. Mayor and members of the council. It's really a great pleasure for me and my county colleagues to be here today to have this conversation with you. I think we're all really struggling in the public sector with how do we continue to provide the really good services that we've done for a long time, but recognize that in some ways it's not enough. And so we very much appreciate the opportunity to have a discussion like this where we can really think deeply about what next, how can we deepen our collaboration, how can we deepen our impact. So we look forward to this conversation today and beyond. So mostly I'm going to be a bit of the MC. I'll tee us up here and then turn it over to my colleagues. I think the context for us is recognition that our board adopted some very important and key strategic priorities just last month and directed county departments to work more closely together in pursuit of these four strategic priorities. The first one is the one we're going to talk with you about today, and it is securing our safety net. Marty Robinson will give you a little bit more information about the context there, and the rest of my colleagues will also sort of chime in about it. I think that's the focus of the information we want to share today with council and the public. There is a related but different priority the board has adopted for us, which we're calling Housing for All, which is really more about a production agenda around affordable both rental and ownership housing. We can touch on that if there's time and interest, but there is a set of strategies and some goals connected to producing housing while we're also paying attention to the safety net. And I think there's very much opportunities for collaboration in that vein as well. The other two I won't spend time on. Rebuilding our infrastructure is an important priority for reasons I think you can understand. And then there's this one about helping watersheds, which calls on regional parks and ag and open space districts and the water agency and others to really think about the environmental health of the county. And so those are what the board of supervisors have said to us as the county departments. These are your key priorities, and so that's the context in which we come to you today. So securing the safety net, I'll turn it over to Barbie Robinson, and she can give this context.
Good evening, Mayor and council members. I'm Barbie Robinson, and I'm the Director of the Department of Health Services. And as Margaret mentioned, the board approved its strategic priorities on April 4th, one of which is the safety net priority. And the vision for that priority is to improve access to safety net services. And not only improve access to the services, but also move people through the safety net. I think if we think about our war on poverty programs of the 60s and 70s, we really focused and emphasized on developing a safety net. And the next phase of that work is to move people through the safety net to better self-sufficiency and well-being. And so our safety net priority focuses on that vision. And so some of the goals in terms of what we're trying to work on is improved health outcomes, improved well-being and self-sufficiency, improve referrals and access to services, and also increase the number of people that are accessing the safety net while we're reducing the duplication of services and resources. Margaret, the next slide. The county departments that are taking the lead on this priority is my department, Health Services, Human Services, Child Support Services, Probation, the Public Defender, and the Community Development. Our departments, we've dubbed ourselves the safety net departments. We know that we actually are serving the same population. We know this anecdotally. And so our goal is to really think about how we strategically utilize our resources and coordinate our programs and services to improve outcomes. And so I'll just touch on some of the projects and initiatives that are being developed out of this board priority. There's a project called Project 301, for lack of a better name. And that project is identifying 301 of the most vulnerable individuals and or families within Sonoma County and providing intensive wraparound and resources for those individuals. We're still in the framework, conceptual framework phase, But we know that we're looking at individuals who are homeless and who are also have mental health challenges. And so that's one of the projects that we'll be standing up. We'll be reaching out to community partners to help engage us in further refining the framework for that program. Another project that we're undertaking under this priority is the Whole Person Care Project. And that is actually a grant program that is funded through the California Department of Healthcare Services. And that project, again, is looking at individuals with serious mental illness who are also homeless and working with our healthcare partners to coordinate services for those that are high utilizers of multiple systems. Another project that we're working on is a project called the Stepping Up Initiative. And that project is a diversion program where we're trying to identify individuals with serious mental illness or other mental health challenges and diverting them from the jails and getting them into the appropriate community services. In terms of developing and strengthening our system of care around behavioral health, Mike Kennedy is going to talk about the existing programs and some of the programs that we're expanding in response to need as well as to addressing the board's priorities. But we also recognize that part of the system of care, one of the immediate needs we have is for inpatient psychiatric services. So one of the other initiatives that we're engaging in as part of the board's priorities is working with Marin County to develop a regional psychiatric urgent facility where we can actually have access to inpatient psych beds. And so with that, I will turn it back over to Margaret.
I wonder if I can stop you there for just a minute. I had a question about the Project 301. First of all, how did you come up with the number 301?
So we're actually, it's a prototype, it's a proof of concept project. Our goal is to identify these 301 most vulnerable individuals and develop interventions and strategies to move them to self-sufficiency and or improved well-being. And then, based on this pilot, we would then scale it up, and this would just be the way that the county delivers services. And so we looked at a model for a similar program in San Francisco, and they called their project Project 500. And because we're so creative, we're creative government bureaucrats, and we're smaller than San Francisco, we aimed at a smaller target. So really there's no science behind that particular number. The one actually came up when we were thinking about trying to engage the community and individuals in the program. 301 refers to a criminal code. 300 refers to a portion of the criminal code that we thought would be a detractor from actually engaging families and having them participate, or individuals in the program.
And I'm assuming that this program and the other programs that you mentioned are aimed at individuals, whether they are homeless or housed, regardless of their living situation.
So the Project 301, the two overarching criteria are individuals who are homeless or at risk of being homeless, who also have mental health challenges.
Thank you. And we have some more questions.
Thank you, and thank you for the presentation on the program. It sounds like there's 3 or 4 programs. I'm not sure if Stepping Up is counted in the 4.
It is. There are a number of other projects, for example, like, expanding, developing a behavioral health campus. I didn't mention all of them in the interest of time.
All 4 that you mentioned
Yeah.
sound as if they have a mental health component.
Yes, they do.
Okay, that's what I wondered. And are you using I think it's called the VI SPDAT for your vulnerability rating index, or are you using another document?
We're not at that part. We're at the initial planning phases of our project, and so we have not got to the actual methodologies. We're developing the conceptual framework right now.
Okay, thank you.
And if I may, it'll be similar to that, looking at those that are most vulnerable. And so there'll be a criteria, whatever we decide to look at.
Okay. At some point, I would like to have a conversation about where women and children fall within the VI SPDAT as opposed to chronically homeless men. And I particularly because there are, you may find a person who is in a domestic violence situation who doesn't rate as highly because they are not exactly currently homeless.
So we have contemplated that, and I have the visual of our conceptual framework in my mind in terms of the matrix of potential demographics and populations who would be eligible for the program, and women and children are amongst those that would potentially be involved in the program.
I'd really be interested in seeing that in the future time, how you come up with your vulnerability index.
Absolutely.
Thank you.
Well, thank you very much. I'd like to ask a question about a different 300, and I don't want to derail us too much because I know there's a lot to go in. But could you talk a little bit about what the county is doing in preparation for the closure of the developmental center out at SDC? Because I do know with those dual diagnosis patients that we are working to make sure they have services and places to go in the community. So can you talk a little bit about that?
Yes, it's a priority for us as well. We continue to work with the state and our partners to identify solutions for ensuring that there is a system of care in our community. Many of the residents that are in the developmental center live in other places outside of Sonoma County, and we've been working with our clinic partners with the Santa Rosa Community Health Center to develop a primary care clinic that specializes in behavioral needs for that particular population. We are aware and concerned. We want to make sure that we do have a system in place for individuals that live in Sonoma County that will continue to live and reside in our county. So we continue to plug away and work with the state to identify solutions.
I appreciate that. And I know that there were dollars that were allocated. I know the closure slated for 2018. I don't think they're going to hit that. But I know that there were dollars that were slated, particularly for finding housing solutions in Sonoma County. Have we seen any of that housing actually be located or created up to this point?
We have not seen the housing at this point.
Okay, thank you.
Thank you. One more. I recently learned of a study that showed that children that are not securely housed, that have to move twice within the course of a year, are 60% more likely to be hospitalized in the next year and 50% more likely to show developmental delays. Is the health services program specifically looking at secure housing as a solution for childhood health issues?
Yes, we absolutely see housing as one of the social determinants of health. And we recognize that housing, access to education and income are really the critical factors that determine your health and well-being. And quite honestly, if you're accessing healthcare services, then we've actually missed the mark in terms of having the opportunity to improve health outcomes or to prevent you needing healthcare services. And so that's a priority for our department to address and work collaboratively with our other safety net departments to address housing needs. That's why it's a priority for the Board of Supervisors and the county and our safety network.
Are there specific health services funds dedicated to housing?
I think through this project, yes.
Thank you.
And Mike Kennedy will talk more broadly about the housing that's available to folks that we see in behavioral health services.
So hello again, Mayor and council members. My name is Karen Bees. I'm the Director for Human Services for the county. And I'd like to start, Marge, go to the next slide, about our broad brush human service programs in general. And then I'd like to focus a little bit more on the services that are for individuals who are at risk of homelessness. And then finally ending with the services that are dedicated specifically to homeless individuals. So the human services programs that are shown in front of you here, we have 4 separate but collaborative divisions that work with our clients. Our adult and aging division works with adults who a variety of services that are shown there, adult protective services and in-home supportive services being the primary services there. Employment and training has the Sonoma Works program, which is a public assistance program providing cash assistance, homelessness and housing assistance, which I'll mention in a second, training dollars, services to help people become self-sufficient. And we also have the Workforce Innovation Opportunity Act programs, which in Sonoma County, people know by the name of services through JobLink. In our Child Welfare Division, or Family, Youth, and Children, we have Child Protective Services and other child welfare services, adoption, foster care, placement services, and we have the Valley Litter and Children's Center, which is a shelter on Highway to Home. And lastly, we have our Economic Assistance Division, which targets on other public assistance programs to help individuals who are low income, and that is CalFresh, which used to be called food stamps in the old days, general assistance, and then we also provide eligibility for Medi-Cal, County Medical Services Program, and ECDC, which is another Medi-Cal type program. So I'd like to talk to you a little bit more about services that we provide for those at risk of being homeless. So I want to start by saying that the majority of our programs serve clients who are low income and who meet the HUD definition of low income and being risk of homelessness. However, our programs have a little bit more eligibility requirements in addition. By HUD guidelines, I believe, and I can be corrected, and right now the annual income of 30% of median family income for the area, which is about $54,000 in Sonoma County. And in the cases percent of people in Santa Rosa itself, in CalFresh, we have 10,000 cases or 18,000 individuals receiving CalFresh in Santa Rosa. Medi-Cal, we have 32,000 cases or almost 60,000 people on Medi-Cal in Santa Rosa within the city limits. In Sonoma Works, also known as CalWorks, we have about 1,200 cases or almost 3,000 individuals in Santa Rosa receiving services. In general assistance, which is our services for most indigent, usually single widows, we have almost 300 individuals in the city limits of Santa Rosa, and that's about 300 people. Also, I want to give you information about the total cases of CalFresh and general assistance households, which list their address, if you will, as homeless. For CalFresh, we have almost 1,700 individuals who say they're homeless and receiving CalFresh and or general assistance in Santa Rosa. And for general assistance, we have approximately 90 individuals who say that they are homeless within the city of Santa Rosa. So some of the support services that we offer to people who are at risk of homelessness, families with children, and this can be either single individuals or two-parent households. Families with children can access CalFresh benefits, which I mentioned, which is food assistance program, child welfare services, child support services. We connect them with child support to improve their income and family functioning. We have Medi-Cal, as I mentioned, and Sonoma Works. Older adults, we have also can link individuals to CalFresh. We have a program, which I'll mention in a minute, called Linkages to Senior Housing and Home Supportive Services, to be able to bring an individual into someone's home, to help care for them, ensure that they can stay in their home as they age. We have Medi-Cal benefits, and we have veteran services as well. For any adult, we have, again, adult protective services, again, CalFresh and general assistance, Medi-Cal, JobLink services, and veteran services. And for current and former foster youth, which are programs targeted mostly to 16 to 24-year-olds, we have housing programs for active child welfare cases. We also have CalFresh benefits, child welfare services, and a program called Independent Living Skills Services, which is aimed at assisting transitional age foster youth, gaining the skills to live independently and being Medi-Cal. Now, the meat and potatoes for services for homeless are here in front of you today. And one of these programs for families with children, we have a program called Housing Assistance and Placement Program. This is a Housing First program that we contract with Interfaith Shelter Network. And services include the following. And one of them is in Kenwood. We provide intensive case management focused on obtaining and maintaining housing. And we also provide direct financial assistance as needed to cover application fees, security deposits, utility deposits, rental or utility arrears, and rental subsidies. We've operated this program since January 2016, and to date, 73 families have been served. 46 families are currently participating in those services, and 35 families have obtained permanent housing. 29 of these families are permanently housed in Santa Rosa. Recently, the County of Sonoma and the Air-Based Shelter Network were awarded a grant to expand the housing program to house 62 additional families enrolled in child welfare each year, which we're very pleased with. It's a federal grant, and we're very happy to get that. Another program is our child welfare partners with the Housing Authority here, our partners, to access approximately 50 housing vouchers through the Family Unification Program. 42 families are currently utilizing these vouchers to subsidize costs, and 31 of those families are currently living in the city of Santa Rosa. Additionally, 12 families are seeking housing or are in a pending status. So this program worked closely with the first program I mentioned to utilize case management and to serve families with the goal of obtaining housing with their vouchers. In our Sonoma Works program, Sonoma Works, you have to actually be eligible for Sonoma Works, and it's typically you have to have minor children in the home to access Sonoma Works services, and you have to be income eligible. So Sonoma Works has two major housing programs. The first one is called the Housing Support Program. And this is a rapid rehousing model to provide housing assistance in the form of deposit and rental subsidies and rent-ready classes through a contract that we have with our partners here at Community Development Committee. From January 2015, when we started this program has housed 121 Sonoma Works families. Including that count for 158 adults and 213 children, 371 people together. 75 of those 121 families were housed in Santa Rosa. 400 families have been referred to the program, and of those 400 families, 243 have been in the city of Santa Rosa. So in addition to that housing program, we have a temporary and permanent housing assistance Sonoma Works program. And this is one where Sonoma Works clients can be eligible for this program once every year, once every 12 months. And this program, which is our temporary assistance, provides up to 16 nights in a hotel and can potentially help with rental deposits as well. And from January 2016 to March of 2017, 9 families have been housed, and 4 of the 9 were in Santa Rosa. So that's the number one. In our adult services, our older adult services, through Adult Protective Services, we can help homeless individuals with linkages to community resources such as homeless shelters. We can assist clients with low accounts and waiting lists. Sometimes it just takes some case management to help them through that process. Provide advocacy for community housing agencies, one-time limited financial assistance for rent, utilities, and home cleanup. And we can also help with referrals like bill paying services and money management. Our new program that we have that was approved by the Board of Supervisors recently is called Linkages to Senior Housing Program. And this initiative helps seniors to maintain their housing through case management and money management. Since February 2017, when we started, we have a story of one 64-year-old woman and her dog who were living in her car. We were able to place them in the Maribel Lodge in Santa Rosa. And we actually have a contract with the Maribel Lodge to provide 2 spots for individuals who need senior housing there. Also, 2 clients have received housing vouchers and are receiving assistance locating permanent residents. There's a 72-year-old woman on Section 8 who received an eviction notice to not passing her annual housing inspection because she's a hoarder. She received this so that her eviction has been retracted. Her housing inspection has been rescheduled. We were able to give her some funds to clean up her property so she can pass her inspection and maintain her housing. Currently, 6 of the 16 clients in that program are living in Santa Rosa. We also have veteran services officers, which provide an array of services, homeless assistance services to veterans. We have general assistance for indigent adults, and they provide rental assistance of up to it's not a very big number, $377 per month, plus a maximum food and incidental benefit of $148 a month. And for current and former foster youth, we have programs through Voices that we contract with to help foster youth gain skills they need to live independently. We have a contract with the SAY Dream Center to house individuals, and we have a Transitional Housing Plus program to provide services for 2 years to help former foster youth transition to out-of-home placements into independent living. And lastly, we have the Valley of the Moon Children's Center, which is a shelter where children who are removed because of unsafe conditions can go if there's the ultimate safety net. So thank you.
So before turning it over to Michael Kennedy, the division director for our behavioral health division, I just wanted to provide some context for the information that he's going to provide. We know that some of the individuals who we label as the chronically homeless, who are suffering from mental illness or in need of behavioral health services, the programs and the services that Mike is going to discuss are critical and tantamount to being able to move the needle on getting those folks stabilized and able to benefit from being sheltered and moving on to self-sufficiency or improved well-being. And so I would hope that you all would keep that in mind as we're going through the list of services and programs that Mike is going to talk about. And relating it back to the safety net priorities, our plan in terms of some of the interventions and strategies is for us to expand and strengthen the programming that Mike is going to talk about today.
Before you go there, is it possible for us, again, thank you for your report out, is it possible for us to get the data or information that you just told us? There was a lot of numbers in that. If you could get that to us separately?
I'd be very happy to.
Thank you. Also, you talk about the number of people served. Could you also provide the number of people who are on the waiting list, or if you keep the record of the number of people you had to turn away because you didn't have the resource? It would be helpful to have that also.
At this point, we don't have a waiting list. We have entitlement programs, so everybody who's eligible receives our services.
Okay.
So, but I can get you the data, absolutely.
Thank you. That's helpful to know.
And if I could just really fast make sure that I heard something correctly, one of the numbers that you threw out was that you have 1,700 individuals in Santa Rosa who are on CalFresh that are homeless. Given that our homeless number is 1,877, I want to make sure I heard you correctly that, what is that, about 90-something% that are on CalFresh?
That's correct. And we have done a lot of outreach to individuals who are homeless to make sure they can get some food, and so they do have access to those services.
Hello, test. There we go. Yeah, good evening. So before I talk about the homeless service, I just want to give a little context, and it's really brief, and I'm not going to throw out a lot of numbers, because I know we're here to talk about homeless population, but I also wanted to just, I know most people know this, but I just want to reinforce this, that all mentally ill people aren't homeless, right? And all homeless people aren't mentally ill, okay? So just wanted to put that out there, and for us to think about that as the county mental health plan. So part of what we do is through the Medi-Cal system, we're responsible for mental health services, specialty mental health services. So that's services for the most seriously mentally ill. We're responsible for really children, adults, and older adults who are on Medi-Cal, right? So if you're full Kaiser, you're going to get your mental health services through Kaiser. But if you're a Medi-Cal client or Medi-Cal insured in our county, which there's about, I think, 120,000 folks who have Medi-Cal. If you have a serious mental illness, you're going to get your service through specialty mental health, which is what we provide. So we see over 10,000 clients. So then when we talk about the homeless population, when we talk about serious mental illness, it's generally about 30% of the homeless population. And it's, when we talk about the jail, even those who have contact with criminal justice, it's about 7%. So, and that's a lot of times shocking to people, but I will admit, clients that have mental health issues, some of our folks that are involved with the criminal justice system and involved in and are homeless, you really, people are really aware. It's very visual. You see them, you have contact with them. So a lot of times, I think people really think there are more than there are. So I just want to put that out there. And when we look at the data from law enforcement, when we work with law enforcement around calls for service, actually substance use really is much higher when you're talking about service calls than mental illness. So I just wanted to put that context out there. And if we look at the homeless population, the rates of substance abuse, again, are higher than the rates for mental illness. So, and many times it's co-occurring issues. So that's why it's really hard to get homeless folks who have mental health issues, serious mental illness, and substance use off the streets. It would make sense. It'd be really hard to do that. So having said that, I'm not going to talk about all the other services that we provide for kids, and I'm just going to focus on the services that really target the topic tonight. So I would start out with, and again, I said Medi-Cal covers much of our services, but Medi-Cal does not cover outreach or engagement in the community. So just a plug for the Mental Health Service Act, and for any folks who make $1 million or more that contribute to it, thank you very much. We're really using it. We're really using it to do outreach, engagement. This program that I'm going to talk about, the Community Intervention Program, is fully funded through the Mental Health Service Act, and it allows us to really target services in the field to homeless folks with serious mental illness. So what we do is we're actually in the field. We work closely with homeless providers. We work closely with, we're in partnership with Brookwood. We have psychiatrists at Brookwood and clinicians, and we serve folks through Brookwood and then also in the field. We also work with all the providers here in Santa Rosa to really try to assess and identify those homeless people that have really serious mental illness so that we can then link them to a higher level of service. So you can go to the next slide. Let's see what I got here. So again, we're going to talk, what I'm going to talk about tonight is what we do is screening for mental health services. We also do case management. We also do linkage. And we also work in partnership with everybody here. We really work closely with Human Services. We work closely with CDC. We work closely with Probation. We work really, we have to work with everybody because, once we get to know individuals, they have a lot of overlap with different services and a lot of issues that need to be dealt with. We also are the ones, if somebody is a danger to self or others, we're going to be doing the involuntary hospitalizations, and meaning we work with law enforcement to do the 5150s and bring people in, do crisis stabilization, and I'll talk later a little bit more about that. If we go to the next slide, you can see all the partners that we work with, the Living Room, Redwood Gospel Mission, Sam Jones, Catholic Charities, all their programs. And then in the other parts of the county, we work with the homeless providers too. We also are in the field. Well, we a lot of times will actually work with the public library. We actually have done trainings there too with folks to help folks learn how to deal with individuals with mental illness. And we also work with Vet Connect. And if there's a veteran who's in crisis, again, we would hospitalize them. We would then work with the VA and figure out, do they have coverage, do they not, and then make sure that they get the service. If we move to the next slide. Again, this program we implemented through, again, the Mental Health Service Act, and I think it's one of our most successful programs. It's a partnership. Started out with just Santa Rosa Police Department and the Sheriff's Office, where we, 7 days a week, 2 to midnight, we both agencies have a phone, and my clinicians meet them in the field. So if they're on scene and there's somebody with serious mental illness or that needs services, whether they're homeless or whether just a resident, then they call my staff. My staff will stage out there and wait till they're given the thumbs up because things are secure, and then they'll come in, and a lot of times then they'll take over, and we move it into more of a treatment, and it allows law enforcement to step back. And one of the best programs we have now. It's been so successful that we've expanded that also now down to Rohnert Park, Cotati, and Petaluma, and we're looking to try to get it out. The next place would be Guerneville. Again, we meet law enforcement in the field, and then a lot of times what we would do then is transport and take folks, if they meet criteria for involuntary hospitalizations, over to our new, it's been open a year now, our new crisis stabilization unit, which is over at the lakes, right off Sebastopol Road on Corporate Drive there. It's a brand new facility. It's got more capacity. We like that it's in Santa Rosa because we love Santa Rosa. And we love working with Santa Rosa. SRPD is really a great partner with us. And then also, this is a place where we can bring people, they can stay there for a few days, stabilize. We can get them on medication. And it's a secure unit. We didn't have that when we were up on Chenate. Next slide. We just in December opened out by the fairgrounds a second crisis residential house. So it's a 10-bed house. We already had another one that we've had open for about 6 or 7 years. So now we have 20 beds where if somebody comes off the hold and they need another 30 days, they can stay at these houses for 30 days until we can stabilize them. It's really an excellent program. It's a home-like environment. And then that gives us time to find other options for people to then go to. We could probably use another one of these, though, already. Just open that one. Then I wanted to just touch on detox. I think, everybody's aware there's a 15-bed detox program out at the Orinda Center on Neotomas out off of Farmers Lane. That's where folks are brought for up to a 3-day detox. That program, along with substance use treatment in general, we're about to expand in the fall. We've opted into a new federal Medi-Cal drug program, which is going to give us more funding and more services. And at the same time, we're going to move the detox program from the Orinda Center. We're going to expand it to 30 beds, and we're going to move it 2 buildings down from our new crisis stabilization unit. So it's really going to be nice to have the 2 programs, same site, ambulances, law enforcement, don't have to argue with each program. Is it mental health? Is it substance use? Is it mental health? They won't have to do that. They can just drive over there and then drop them off to us, and then we'll figure it out.
Mike, do you want to talk a little bit about the behavioral health campus? It's one of the
Yes.
board's priorities.
So the other thing is that these are the first 2 steps in really us moving all mental health services out to that campus out on Sebastopol Road, where we're going to have all our outpatient services, really all of our services. And we're going to call it a behavioral health wellness campus. We're also going to have a health clinic there too, so we can do everything at one site. And I think it's going to really improve services, especially getting out of the facilities up on Chenate there.
Qualify that. You mean it'll house all of the services that aren't place-based in other parts of the county?
That's right. Yeah, so we will still keep open all of our offices that we have, and actually we're in the process of expanding some of those. Petaluma, Guerneville, Cloverdale, and in City of Sonoma. All those will continue. But we will have all those services that we have centralized here in Santa Rosa. And obviously the largest number of folks that we serve are here in Santa Rosa, of course, because of the population size. We have another, it's really a shelter for mentally ill folks who are homeless. It's called Opportunity House. The Community Support Network runs it. We fund it. And we also have a house that we run through SAY for transitional age youth, which is called the Mayo House. So we also have a lot of housing for mentally ill folks that we've worked on through the years, including apartments, subsidized apartments. I think the key for us is that when we have this kind of housing, you have to have wraparound services provided at the housing. For folks that are serious mentally ill, you can't just put them in housing and then expect that it's going to be successful. We actually have contracted services that are there sometimes 5 days a week to make sure folks are taking meds, to make sure folks are taking care of themselves, food, those kinds of things. So again, you know, the project that Barbie brought up at the beginning, the Whole Person Care Project, it ties back to the original community intervention program I just talked about, because that funding is going to expand that program, so we'll be able to have more people in the field and on the ground just focused on serious mentally ill homeless individuals. So the work we already do with Catholic Charities in Brookwood, we're going to be adding staff, more staff, to be able to really follow people and really carry what we would consider homeless mental health caseloads, right? But again, really target that 30% of folks that we know, you know, those folks that you see on the streets that they have psychosis, they're really struggling on the street. We'll be able to add staffing to support all the services that are being delivered.
So that concludes Mike Kennedy's look at behavioral health services. Do you want to entertain questions before we move on?
Any questions for Mr. Kennedy?
All right, very good. I'll turn this over to Jenny, and I see that we're pressing the time limit, so I know she knows how to get through her presentation quickly. A lot of our services mirror what you heard about from Kelly Kuykendall from the city, so some of this will be pretty familiar. Jenny?
Thank you, Margaret. Good evening, Mr. Mayor and members of council. So this slide that Margaret is showing you right now is, it represents the Community Development Commission's investments in homeless services in the city of Santa Rosa. Overall, we fund about $3.5 million throughout the county. 2.7 million of it is here in Santa Rosa. And there's a listing on the left here of all the different funding sources. We can go into them if there are questions. I don't think we really need to spend time on it, other than that it's an annual competition that many of the providers who are here participate in. And then there has also been more than $1 million of board designated funding in response to issues that come up. So let's just go on to the next. This has been an interesting comparison for us to take a look at. The pie chart on the left is where our homeless count found people. This is in the 2016 count. So 64% of the people that we found unsheltered last year were in Santa Rosa, which justifies a lot of spending on behalf of the county in the city. And then the chart on the right shows you where the funds are being spent, but please also remember that a lot of the countywide services, the 31% of our funding, this is in the coming year, our projected funding. So there's some mistakes in the slide I see, but in any case, that 31% is countywide, and much of that based here in Santa Rosa as well. This was an exercise I did to see if we were actually reasonably distributing the funds based on need. So that's one major portion of what we do, is directly funding homeless services. In addition, we host and staff the Continuum of Care planning process. This is a federally mandated planning process in order for local agencies to access. Our share is about $3 million annually coming through this collaborative effort. 1.4 million of it is spent in Santa Rosa. Among the many mandates of the continuum of care is a 10-year homeless action plan that we updated last in 2014, and that actually sparked some of the additional work on the Building Homes Toolbox and some of our other housing efforts. We conduct the annual homeless count. We manage a homeless management information system in our office that all our homeless service providers contribute to, matching federal data standards and reporting on federally mandated outcomes, including, next item there, system performance measures. There are 7 measures that we're required as the continuum of care on behalf of all homeless providers in this county to report on. They include things like the number of people, but also the number of placements in permanent housing, the number of people who have been placed in permanent housing in the last several years who became homeless again. So part of what the system performance measures help us do is see how well we're doing actually in all the things that lead to ending homelessness for the people who we're serving. Another requirement, which I know this council has heard a lot about, is coordinated entry. In the last few months, HUD published standards and compliance standards that we're working hard to meet by next January. So there's just a lot of work related to this, and it's certainly been leading HUD from the federal level, and also State Housing and Community Development has been leading in this push to transition our entire system to a housing first approach, not just because it's evidence-based, although it is, but because as a system it's the best, most cost-effective way to end homelessness. See, the continuum of care, I made myself a little note. It has existed since 1997. Currently, the structure is that it has a 15-member board. As Kelly mentioned, the cities of Santa Rosa and also Petaluma, as well as the commission, have standing membership. County Health and Human Services have seats, and one of the requirements of a continuum of care is to have membership of people with lived experience in homelessness. So the rest of the membership, this is something that's developed historically and was where we were what we were ready to commit to when we developed a charter a couple of years ago to be compliant with the rules. It is not the only way to organize ourselves, and we're actually currently looking at other ways. There are a series of working groups, just really quite amazing group of people, many of them here in this room today, who have been working on a number of efforts. We hold quarterly membership meetings, the third Thursdays, this is a welcome to anyone, third Thursdays of January, April, July, and October in the afternoon in our offices. Let's see, next. So Margaret asked me to speak about the homeless system redesign that we're entering into right now. We are basically trying to address 3 major challenges that we as the CDC are facing and our homeless system of care is facing. The first being that there are significant funding losses to our system of care in the last couple of years. They have to do with changes, regulatory changes at the state level. But basically we're operating with about $800,000 less in 17-18 than we had this year. Our committee that has helped with determining awards is asking for clear priorities in that context. And as the entity that is now administering the state dollars that require us to move to a housing first system, we are looking to address programmatic changes. So we've just contracted with Home Base, the Center for Common Concern in San Francisco, to be our consultant to lead this process. I'm sure we'll come to you if you invite us. But they will be working on a scope of work that is defined by our needs to redesign our funding process this summer. Yeah. And as it says at the end of that last slide, support providers in the transition. We know that this is a very big change. Some of them have been moving along, chugging along to get themselves there on their own, but it's going to be a big change for a lot of people. I was also asked to address what has happened with the state emergency solutions grants. This is the funding source that has been so impacted. Let's see, previous to 2015 or until 2015, the state, let's see, backing up just a bit, these points are important. Emergency solutions grants fund essentially emergency shelters and rapid rehousing. The county has, as a jurisdiction, received a small direct allocation from HUD for many years. Or jurisdictions like the city of Santa Rosa that don't receive an allocation of ESG funds, they can go to the State Department of Housing and Community Development, which has a balance of state allocation. So Santa Rosa and Petaluma-based agencies have gone to the state for many years and really sometimes came home with 10% of the statewide pot, which is kind of unbelievable. That's why, let's see, in 15-16, local agencies had $1.2 million from that source. When the state entered into new rules to geographically allocate those funds, we end up with an annual allocation of $239,000. So that's the big reduction we're looking at. The new rules required the ESG recipients, that is the CDC, had to be chosen if we were going to hold on to those dollars to administer the state portion. Last year, the Board of Supervisors backfilled with a special allocation of $800,000 to keep the providers whole while we figured this out. And the state legislature funded a 3-year program to add funds to the program. That brought our allocations this year to just over $400,000. That's helpful, but basically the loss is $782,000. And this impacted in our funding process the Family Support Center. And I think that's it. I mean, happy to answer questions.
Thank you for the presentation. So for the ESG program, are you saying that have they switched to now allocating based on the population, not necessarily the need in each jurisdiction?
It's a complicated formula that includes population and includes the number of people who are homeless in the community. So it does address some of the things that we would want to have in a formula like that, including rent burden. But still, when you spread that out across the entire state, we end up with a very small portion.
And is your realignment with these funding losses, is this taking into account any of the community development block grant conversations that are happening and potential reductions in that as well?
I think we will talk about it, but we can't really say what's going to happen yet. You know, the proposal that just came out from the White House in the last day or so is simply a proposal, and I think the congressional delegations have been rushing to say it is just a proposal. It's theirs to develop a process and a budget, and many of them love CDBG.
Great, thank you.
Let me just add to that. I think what we want to be able to do is be responsive to a changing environment. We don't know, what the next several years are going to bring from the federal government or from our state partners. So I think part of what we want to be able to do is be a little bit more nimble in thinking about how we partner with our providers and what goes into those contracts and what goes into our competitions and all of that. So.
Thank you very much for the information that you've brought to us. I am very interested in your homeless system redesign and wondering a couple of things. First, as a city, How do we participate in feedback and input and understanding the redesign process? And how do members of the general public take part in the redesign process?
What I can say is that there's a general intent to solicit very broad input into the process, and we're still developing the work plan.
But let me also underscore that we have been working closely with the staff, Dave and Kelly. We brought them in early to say, this is what we're doing. Help us make sure we get the scope of work right. Let's think about creating enough flexibility so that when you're ready to engage, right, that we can make sure that we're not doing it in isolation. So that's, again, it's very much our intent.
I know as a council member, I have a strong interest in following what's going on, and how would I access information about where we are, where you all are in the process?
We'll reach out, but we'll also think about how we put, helpful information on our website for the general public to access. But
Okay.
we'll be happy to follow up with you.
Thank
or
you.
any other council member, of course.
Ready? Okay. Mayor Corsi, council members and staff, and members of the public, happy to be here this evening. David Cook, Chief Probation Officer. I think it's important, as Michael offered earlier, to provide some context. So the Probation Department supervises approximately 2,600 adult offenders. Probably 40 to 50% of those are residents of the city of Santa Rosa, so somewhere between 1,000 to 1,300. Our clients that we supervise access services from the health department extensively through behavioral health and also human services, and then a variety of community-based organizations located throughout the county. Specifically to homeless, we estimate that roughly 8% of the total population are homeless or transitory, meaning couch surfing, don't have permanent housing, so around 200 thereabouts. As far as what we offer, in addition to those services that have been described earlier, the Probation Department funds 30 beds. This is transitional housing aimed at 90 days. Oftentimes, those beds are extended. People are able to stay longer. And those are offered through Interfaith Shelter Network. There's special housing for sex offenders, females, and then the remainder go to the adult male population. Beyond that, and I want to point out, we're very fortunate, and we were very intentional about this in embedding behavioral health staff from Mike's office with the Probation Department, and they essentially they do the assessments, and then they serve as the gatekeepers for our housing resources. So they're doing the placement not only into the transitional housing, but also into the residential treatment, substance abuse treatment. As you can imagine, the vast majority of clients under our supervision have substance abuse issues, and a high percentage have mental health problems. We also work pretty closely with Catholic Charities and have a small contract with them to help facilitate placement of individuals. And frequently, our clients access various shelters, Sam Jones, Redwood Gospel Mission, etc. And the priority for the transitional housing, those 30 beds I mentioned, are people returning from state prison that we are responsible for, and then also people transitioning out of jail. So that's the priority population that are in those transitional housing beds. With respect to juveniles, there are about 300 kids under supervision in the county. And as Mike mentioned, the transitional age youth, those who are 18 to 24, can find shelter services at Tamayo. We also, as Karen mentioned, have contract with them, with Human Services for the Dream Center, and then also youth access the Coffee Teen Shelter, social advocates for youth. And then youth are referred quite often to Voices, and they assist in housing placements as well for homeless kids. The Stepping Up initiative, just what we're looking at in the future, Mike alluded to this, in addition to the beds that are available currently, we're going after some grant funding, 2 specific sources, both through the state, and in particular, we're targeting a population of defendants who are pretrial in the jail, and that means they haven't been convicted and placed on probation. And in particular, the mentally ill offender population or defendant population, and finding ways to divert those individuals from jail. When they get into jail, they tend to spend an inordinate amount of time in custody. Quite a number of them are homeless, and the need for supportive case-managed housing with wraparound services is quite high. And if we're successful with some of these grant proposals, we'll be able to divert more of these clients from the jail and into those community-based programs.
Thanks, Dave. Dave, is there any BSCC or realignment money for this population?
The entirety of the IFSN contract is from the Community Corrections Partnership, the AB 109 funding. It's all state funding.
But specifically targeted for this population, either in
Yes.
housing or rapid rehousing?
The housing is all coming out of the Community Corrections Partnership.
Do you know the dollar figure? for
It's close to
Ballpark.
$300,000.
300K out of the total. What's the total for Sonoma County?
11 million.
All right, thanks.
All right, so finally, we're going to just touch briefly on the No Place Like Home new funding source. This is happening out of Mike's shop. So, Mike?
No place like home? No place like home. So, No Place Like Home is a new funding source that's going to focus on housing. It's a $2 billion bond that's partly going to be paid for through Mental Health Service Act funding. It's going to target mentally ill folks who are homeless, and it's targeted towards housing, but really bricks and mortar, right? It's focused on creating more capacity and building more housing. So about 1.8 billion of it is going to be competitive. So we're going to have to apply for it. About 200 million is non-competitive, and I think right now our allocation will be about 4.5 million since we're a mid-sized county. And you know, the competitive part of it could benefit us because we just went through a competitive, it was called SB 82, which was for Crisis Stabilization Unit and Crisis Residential Unit. And Sonoma County got 4 out of 5 awards on that one. So, and they didn't give us the 5th award because they told us we had too much money from the awards. So we had the best proposal in the Bay Area too. So we're into this competitive thing. So we're going to get as much as we can out of this and build as much housing as we can. And we are going to, part of it is we have to work with the community. We've got to involve consumers, family members in the planning process. We've got to work, we can do multiple projects. So that's going to be great. And again, it's got to focus though on that percentage, that 30% of the homeless that have serious mental illness. And part of the requirements for it is you have to build in services. You can't do a project without building in the needed services for the folks who are going to live there. So I think the first RFP for it will be coming out in December. That's the timeline, is this coming December. So we have a little time to work on planning and talking to folks about different projects. And I know there's a lot of ideas out there already and you need to partner with a nonprofit developer to do it.
So, Mr. Mayor, that concludes the county's presentation, and we're happy to take questions. Thank you.
I'll start then. I really appreciate all the county folks being here. It's great to see so many resources in the community that are available. But the message that I get from this is that our needs are not decreasing, but our resources are, which is not a good message, but it's the reality of what we have. So I appreciate hearing about all the resources and having the expertise that's around the table here. And I guess I kind of want to put out a challenge to all the staff, city and county, to use that expertise and put on your thinking caps. And my question is, what are some opportunities for all of us to better coordinate and collaborate on the way that we deal with homeless issues in this community, as not a county and a city, but as government working together? And I'll just throw that out there.
So as city manager, I think one of the things that is challenging is that we're working while there are similarities and overlap, instead of working from a single contractual model, a single set of goals, we're sending out separate projects and asking for separate RFPs. I think some of that is embedded in some of the traditional divisions that have been within the county. Some rules that were tackled just recently about where investment can go. And the desire of the board of supervisors to see some of those rules changed about investment practices that have challenged collaboration. But I will say, while we're engaged in this, and I have a really fabulous team working on it, I would say that there is a clear separation between where we have expertise and where county staff has expertise. So one of the things that I think the council really needs to strongly consider is how we work together, where there is potential for policy setting, co-joining on that front, and then allowing mechanisms that don't work in competition with each other, but support each other to a solution set. That's one of the big challenges. We've been kind of on parallel tracks, but going it alone. And I'll just give example of one of these. We're struggling with the entire impact of, as you said, Mayor, the reduction of funding. But right now, because we hold all these separate contracts, even though potentially with the same contractor, if we were to go out as was proposed for additional RFP on homeless services, I think we'd be backsliding into that conversation where we really need to be co-joining forces, jointly managing this and figuring out where the policy check-in happens and the oversight happens from the elected body. So right now, one of the pain points here is that we're going it alone, even though we're maybe having the same structure and the same general approach. And so one of my appeals to both bodies is, how do we figure out that change so that we're not sending out repetitive, redundant, and you're spreading your dollars in a way that's most impactful. But one of that you have to come into agreement as elected bodies what success looks like, how we're going to define that success, and where the electeds fit in that conversation of the oversight. So I'll put that out on the table and we can go from there.
Anyone else have thoughts on this? I mean, I understand that it's difficult to have these kind of conversations, even in a workshop session, but we need to break down some of the walls that are just naturally built into the system here. And I'd like to hear how elected officials can facilitate some of that. Mr. Rogers.
Thank you, Mr. Mayor. One of the things that struck me listening to all of the different things that the county is doing is that you very much have the apparatus that we're trying to build at the city, that this is something that we are grappling with for the first time, and the county has been doing this for a long time. And just trying to figure out how can we I mean, I don't know if it would even be feasible to sit down and have essentially a budget meeting with the Board of Supervisors and the City Council saying, we're spending money doing this, you're spending money doing this, here's how we overlap, and is there a better way that we can align our dollars and our expertise, as the city manager was saying, because we're trying to recreate the wheel at times, I feel like, at the city.
I'll offer a little from the
Thank
county.
you.
I'm not going to try and speak for my supervisors, but what I would say is I'm relatively new to Sonoma County in this position, although I've done similar work for many years. I would say that at the staff level, I feel like there is really good momentum towards collaboration, really under Sean's leadership, under Dave's leadership. I can see that we're deferring to each other, we're calling before we take an action. You know, we're not all the way there yet, but I do want to assure the council that I think at the staff level, there is a very real intent on trying to collaborate in new and better ways. So we're all in from the staff level, and what that looks like in terms of policy and budget decisions, I think remains to be seen. And I know you'll have this conversation with the supervisors as well. So.
Mr. Mayor, I would echo that too, and an example would be the system redesign you just heard about, the compatibility with the scope of work, the solicitation of proposals for these services that Jenny just mentioned. That work is in progress right now. The whole housing first model is driving us, whether, you know, to this collaboration. The homeless management information system is the device we all must use to report out our data points and get this federal funding, et cetera. So almost by design, it's causing that dialogue to occur. I would just add that as well.
Thanks. Mr. Tibbetts.
So at first I want to thank everybody for putting this special meeting together. You know, going forward, the one thing I'm really going to be curious about and looking forward to is really identifying ways in which we can align our goals, because I think that's going to be the first critical step. The second one is about measurement. I heard earlier that it sounds like we operate under the VIA SPDAT, and it sounds like the county is currently in the process of identifying what your vulnerability index is going to look like. Or am I mistaken there?
We have been using the VI SPDAT. We initiated it with the host team, and then the city actually added to it and has been using it as well. It's one of several tools that measure vulnerability that are in use in this county. Actually, the VA uses a different vulnerability assessment tool. So it's something I've recommended for Project 301, to be looking at the different tools, different ways to identify vulnerability.
I was just going to add that I think one of the things that we can bring to the table and want to support is looking at a more holistic approach to how we're doing the work. And so making that philosophical shift instead of thinking in silos, and that's kind of what we're doing around with our departments within the county, but offer that also to the city in terms of thinking about how you approach your work, that we're making that philosophical shift and thinking about the whole person's needs. And so while that might be one system that we use to identify vulnerability, if we're really going to get out of our silos, we have to think about how do each of our systems identify vulnerability and utilize that information to come up with a collective approach.
And that's exactly what I was driving at, was it's trying to identify that alignment in how we measure vulnerability and what we drive for. I mean, who are the populations we're targeting here together? That way our resources are targeted to the same people. And the third thing is obviously money. You know, I think going forward is the more the city and county can work together and share financial resources in addressing this problem, I think that we're going to have compounding returns. And I hope that's something that the two bodies can get to in the future. And the last thing I wanted to ask was nonprofit service providers. So we contract with a number of different nonprofit service providers. Are they going to be at this table with us anytime in the future, or will they be providing information to us through staff? Because I think it might be very important for us to gather their input about what their bandwidth is, what their needs are, and what capacity do they have to address this problem.
Mr. Schwedhelm.
Thank you, Mr. Mayor. I just want to respond to the city manager's question, the challenge for the elected officials. It's difficult to have the conversation. This is not a criticism, but half of the elected body isn't here. So regardless of whatever direction we ask, the county folks, and I'm very appreciative of you guys coming here, that there's 5 other folks you need to run this by. And I would just ask that most of the information, maybe not, some of the information that Karen was saying, the specific numbers, all that information is out there. The COC's website, there's a tremendous amount of information, and I would just encourage other electeds, find out the information. Don't wait for the folks to come to us and tell us how the system works. Understanding the system, I think, helps electeds see how we can connect the dots with our other elected peers. I know many of you just from our Santa Rosa Homeless Collective trying to do that, so we're not duplicating services. It's all out there. So I would just really encourage other electeds, and I've said the same thing to many of those on the Board of Supervisors. Yeah, that's got to be a thought. How do we do this together? Because homelessness does not know the boundaries of the city of Santa Rosa. It's a regional effort, and so everything we do, and with the COC, you have 3 entitled organizations. Petaluma should be at the table too, because we can't be figuring out what's Santa Rosa's strategy, what's the county strategy, and Petaluma's going to do another one. And then you look at the umbrella of the COC, they're all under the same umbrella. So again, I would just encourage, don't sit on the sideline, get engaged. And the other thing is, and I appreciate Vice Mayor Tibbetts talking about the service providers. Sometimes get out of their way and maybe asking, how can we help? Because so many times the bureaucracy of government gets in the way of accomplishing tasks. But again, I think all this stuff is out there, and for me, since we adopted that housing first approach, let's be aggressive with that and actually walk the talk. Tie our funding into programs, and I heard Jenny very politely say some people, it's not that easy of a transition if maybe you haven't been there for all those organizations, but that's where I think this, elected officials understanding housing first. We've said that's our priority, that's going to end homelessness. Now let's let our funding follow that, and people will follow. The money will follow that need. So that's just what I would encourage in response to what the city manager said. Thank you.
Thank you. Anyone else? Mr. Sawyer.
Thank you, Mayor. Something just came up that I'm a little bit curious about, and that would be our nonprofits and how they, given that they are working directly with the funder, whether it be the county or the city, they would be very, very well versed on what they are doing that may be a duplication in both the city and the county. And I'm wondering if there is a way to, a vehicle to analyze where there is duplication and where the gaps are. They, of all people, other than those services directly provided by the city and the county, and I know with the city that is really most of the services we provide other than Sam Jones Hall, I believe are through our nonprofits and our contractors. Having them in one room looking at their duties and what they are contracted to do might be a little intimidating, actually, because do all of the nonprofits know what the other nonprofits are getting as far as funding? How protective might they be? How might they be uncomfortable in sharing that information, and how can we make them more comfortable about that so that we can start to identify those gaps and gaps or duplications? I'm not sure how that might work, but I think if any way that we can open those doors and make them feel more comfortable about that kind of sharing, I think would be valuable.
Thank you. And I want to agree with my colleague that bringing all of the municipalities to one table sounds like a very good idea to me. Petaluma, but also the smaller cities may need to be here. It sounds a little bit like we're talking about some kind of a joint powers entity. I'm not specifying that. I'm just saying it sort of sounds like we're talking about something where electeds can sit together and make some decisions about how we move forward and how much special or individualized services we need within our city. Balancing that with the overall needs of the entire community, including within the county. I am always concerned when programs come from the county that have carved out the municipalities that are, for example, only serving the unincorporated areas, and wondering what the source of funds is anticipated to cover the gap within the city. We have predominantly general funds. We're a very sales tax dependent city. So the federal funding seems to come predominantly federal and state funding to the county. So trying to figure out how the funding sources work, how the funding is allocated, what kind of say we have in how those funding mechanisms serve our residents in addition to residents in the unincorporated area. I'm aware of sometimes this works well and sometimes they're stumbling in making sure that the services provided on one side of a municipality's line match the services provided on the other. And it goes both ways. So I think it's really important that we have a kind of unified services throughout the county, including the incorporated areas, recognizing that within the city, we obviously have 64% of the homeless population. We're going to need help with that large number. So I'm looking for how we can work together and work out what are we asking for together from the nonprofits, work out together what the nonprofits want from us, work out what the residents need. I appreciate that there's a lot of data really out there, but I've been trying just to count things like how many beds serve women with children, particularly women who have children over the age of 12. And I'm finding it actually very difficult to find exactly how many beds are there and how much the need is for additional beds in that area. So just taking very basic, simple data, how many are out there, what exactly is the count for what those needs are. Doing that, what I'm hearing is that we're serving the 7% of the population that has jail, 7 to 8% that has jail. I heard a lot of presentation on the 30% that have mental health issues. And I know the governor has recently funded mental health issues. But I'm thinking that leaves a lot of folks who we haven't specifically targeted, and that they have considerable need as well. So I'm really happy we're doing this and really looking forward to sort of how do we get on the same page for those services. And I understand you presented a sampling.
I would just like to share then that, yes, our Continuum of Care Wiki has a ton of information, but in specific, my team is required as part of our Continuum of Care reporting to collect information about the housing inventory every single year. And we can probably answer your questions. I couldn't do it off the top of my head. I will say first that families with children, although there are a lot of panicked families calling in for services through coordinated intake before they have actually become homeless. Out of the total homeless population, there are about 1 in 8 people. And the shelter beds associated or serving families are something like 40% of our shelter beds. There's been a consistent effort for many years to ensure that there was a place for families. On the other hand, shelter isn't the solution, and the rapid rehousing kinds of programs that Karen mentioned out of the Human Services Department and our other rapid rehousing programs are basically understood to be the best practice, the national best practice in addressing homelessness for families. And I would say that the combination of having a pilot project that addressed homelessness among families with children and attempted to match people up with permanent housing as quickly as possible, and the breadth of the services that we have in rapid rehousing for families, meaning rapidly moving them from homelessness into permanent housing. That best practice is what led to a significant decline this year, just since last year, in the number of homeless families that we found.
And just to clarify my perspective a little bit, and I'm sure most of us at this table have had the similar experiences that I've had. I have a list of about 5 people, and I'm trying to get them into housing services. And my experience has been that it is incredibly difficult to get folks into housing services, to get them into a shelter, particularly if it occurs on a Friday, over a weekend. Finding hotel fund vouchers is actually very difficult. So just in terms of personally trying to work through the system, I'm not a homeless person, and I have access to a phone and a car and, all of the resources, and yet, and maybe even some chips to pull, to cash in, to say, come on, give me a hand with this. And yet, having tremendous difficulty, a disabled man with a family, a variety of situations, domestic violence, other severe health issues. It's just really difficult when you're right there trying to get a service for somebody. It's not like parking where you can go a little further out and find a space. So I'm just trying to figure out what we can do so that when I get a phone call, when we see somebody who's homeless, we've got a place for them to go. That's kind of where I am right now, and I'm really happy to have the conversations and to figure out how to most efficiently spend our resources to do that.
So I do not have an answer for the conundrum you just gave voice to, and I think we do very much appreciate it. I want to go back to the question about county-city collaboration and deepening that. What I would observe is that we are not the only set of jurisdictions in the country who struggle with this problem. And sometimes it's helpful to lift our head up and look at what other folks are doing who have maybe broken through this kind of a problem. And I'm familiar with a couple of city-county pairings who have taken some pretty innovative steps in thinking differently about where they draw the boundaries and who does what. And who's responsible for what population. And I think there are probably models out there that we could draw on to kind of give us some ideas to play with. Our hope is that this redesign, we've pinned a lot of hopes on this redesign effort. So I may have my hopes, I may be disappointed. But my hope is that some of these very questions will get some help from somebody who's not from here, but who has deep experience in helping jurisdictions wrestle through some of this. And absolutely our intent is to have your staff at the table and the electeds to whatever degree it would be helpful. So. Be more specific about what is it that you're doing? With the redesign? We don't have specifics yet. We have a scope of work, which we have worked on jointly with Dave and Kelly. But they're going to look at kind of contract deliverables. They're going to look at the method by which we put forward criteria, what we ask for when we do an RFP, what we put in our contracts, and how we hold them accountable. That strikes me as a very tangible work that we do in partnership with you. And that so that we're not asking for different deliverables from the same nonprofits. So that's a good place to start.
That sounds like a great place to start. Thank you.
Mm-hmm.
All right. I'm going to go to public comment here. Invite the rest of the folks in the room to join the conversation. We are aiming at getting out of here at 7 o'clock. And I want the group at the table to have time to wrap up things at the end, to talk about next steps, and to answer any questions if we need to. So I've got, if we have 3-minute comments, we're going to go for an hour and a half. So I'm going to limit comments to 2 minutes so we can try and get through this in about an hour. And we will start. Do we just have one microphone for comment? Okay, so you can come over here. Please be ready if you're the next person. We're starting with Lisa Landris, followed by David Prentice. Is Lisa Landris here? David Prentice. David will be followed by Madeline Brasher.
My name is David Prentice. I spent the better part of the last 20 years working with the homeless and the addicted. The last 7 years I was chaplain up at Lytton Springs ARC before they closed. Addiction issues are not just a genetic predisposition. They are often driven by issues. I've had guys in my office who were doing dope when they were 6, alcoholics by 13, sticking needles in their arms with mommy at 15 years old, being beat up with 2x4s. It covers the gamut. We heard today also that 30% of the people on the streets have mental illness. And in California, one of the greatest things that we were challenged with is the severe lack of abilities of the state to be able to help us in these areas because they're underfunded. Now, the reality of the situation simply becomes this. We can give these guys a roof over their head, but their issues are going to go in the room with them. And so if we do not begin to come up with a strategy with how we address their issues, then we're not really solving the problem. What I've discovered in my time is that faith-based communities are really good at helping in these areas. And perhaps what we ought to be trying to do is to figure out ways to open doors for them to be of more service. Just because somebody does not have a college degree does not mean that they are not qualified to help the hurting. If that was the case, then we would not have sponsors in Alcoholics Anonymous. So I want to encourage you to get this on the docket also. Try to figure out how we can make faith-based communities more inclusive. They want to help. By their faith, it's dictated that we help the hurting, the lost, the addicted, the homeless. But we need to be allowed to help. And the more you can figure out, well, how can we bring you in, the more you're going to get from us. You have over 80 churches in Santa Rosa. Average church is 100. That's 8,000 people in this community that want to help. Give them a chance to help.
Thank you. Daisy, was that your? Okay, so the tone from the iPhone will let you know when your time's up. Madeline Brasher.
Hi, thanks for giving me this 2 minutes. I agree with David. I think a lot of the problem with the homeless that we see on the street is not just simply that they don't have a place to stay. I think it's addiction. I am a Santa Rosa native and a business owner on 4th Street, and I'm now dealing, with, I was asked for crystal meth the other day. Never been asked for that in my life, and I'm 33 years old. I also have to deal with my clientele or young women that don't want to go into my building when these said addicts are sitting outside of my door, begging or catcalling or making advances. So most of the people that I know around my age, we don't even want to frequent downtown because of this homeless population, or I say homeless in quotes as well, because a lot of these people aren't taking. There's also a parking lot, I believe, by the county building. I have a sheriff client that said is open for them to camp at, but they don't choose to use it. They choose to use the park downtown on Sonoma Avenue that connects to Henley Street. The square as well is, in my opinion, $10 million worth of money we could have put to other services that Santa Rosa needs much more than a square of cement. The roads are terrible. We have feces everywhere. The same homeless man that asked me for crystal meth, I seen him peeing on a business on Mendocino and 4th on Sunday at 1:30 in the middle of the day. Sunday is a family day. These are the people that I want to see off of the street and to stop harassing me and my clientele. And it mostly is the drug addiction problem that I'm experiencing. So that's what I would like to see being removed from the street and out of our business doorways. Thank you.
Thank you. ISP Brusher, followed by Patricia Hunstock. Mr. or Ms. Brusher here? Patricia Hunstock. She'll be followed by Debbie McKay.
Thank you for this opportunity to talk. I'm Patricia Hunstock, and I live in the Bennett Valley area. But I also look at now I know why I pay high taxes. California is very, very high taxing, and I have friends that are moving out of California to live other places because it's such a high, not the rents, but everything is very high. So I think we have to be very careful about raising any kind of taxes. But I do agree with the first two speakers completely, what they said. But I really came here to talk about the homeless encampment off of Farmers Lane. Every single day I have to drive there, and I see somebody jaywalking. They don't use the sidewalks, they don't have sidewalks. But anyway, I think that you really need to, and I think it's a poor use of our police to go out there every day to clean up and do whatever they do. That is really a poor use of our services to have them do that. That needs to be cleaned up. It's a disgrace. You can see the blue stuff and whatever, and I feel sorry for the Jewish synagogue there. They're right there, above that. So I don't know if my 2 minutes are up, but I really think that those encampments have to be cleaned up and out of there.
Thank you. Debbie McKay.
Yes, I'm Debbie McKay. I'm a lifelong resident of Sonoma County and probably 30-plus years in Santa Rosa. I've been studying this issue as well, and I commend what you're doing. I commend that you're getting together, and I would encourage you to include Petaluma. And I would encourage you to take the best ideas from all of your cities. All of your cities have been working on this. And I want to give you just a couple of examples. Petaluma has worked very hard on a program called Share for Seniors. And this is a way to use existing housing to house more people. And so I would encourage you to really look into what the city of Petaluma is doing, partnering with one of their nonprofits to get people who have a house that's more than they need to share with another person. And they do a very extensive process to match people up. I would encourage you to look at what Petaluma has done on their granny unit fees. I know you're in the process of adopting your own granny unit policies. I don't know how they did it, but they were able to get their fees down to only 25% of the fees they would charge for a normal, regular development. So I think it's really worth looking at that, and if there's a way to make that really affordable, because I know you're dealing with urban growth boundaries and things like that. Wherever you can do infill, you're not going to have to deal with urban growth boundaries. You're not going to have to deal with Endangered Species Act and a lot of the other things that prohibit you from doing housing. And I noticed that the junior college is offering a course for homeowners on how they can do granny units. I think this pertains to the whole county, but it might be worthwhile the city looking at doing a similar kind of workshop periodically, maybe once a quarter, where you would have your city staff walk the residents who want to do these granny units kind of through the process and what's involved so that people can take that step or decide whether that step works for them. I'd also encourage you're going to soon have all the controversy of the Shanate development in your laps. And one of the things that exists up there is a shelter for women and children. And I would encourage you to try to preserve that, if at all possible, rather than that going away, because that's a really important resource.
Thank you, Ms. Lee. Your 2 minutes are well up. Thank you, though. Ronit Rubinoff, followed by George Uberti.
Give me any warning, Chris.
Go ahead, tip that up.
That up.
So you don't have to bend over.
My name is Ronit Rubinoff. I'm the Executive Director for Legal Aid of Sonoma County, and I just want to say I'm proud to say that we are a partner with both the county and the city in providing services that are upstream and actually help prevent this problem from occurring. Legal aid services help families who are at risk of homelessness avoid that by having time and resources to locate alternative housing. We also help people keep their Section 8 benefits, which is another thing we haven't talked about today, but is very helpful in preventing people from ending up on the street. And the county and city are both working on that. And we also help people, we help the county and city preserve the quality of our existing housing stock. And that's another issue we are facing in this county when we're looking at this idea of our depleted housing stock. We do that by making sure that habitability laws are enforced and that housing conditions don't deteriorate further. Just a quick example, we have 2 cases right around in this area where there are serious mold and leakage issues, and the tenants, low-income Hispanic, complained, and the landlord tried to retaliate and evict them. And we were able to stop the eviction, get the repairs made, and make sure that the tenants weren't out of pocket so they could still afford their housing. So these are very real solutions, and we're part of this solution, and we really appreciate the support and ability to work with you all. Thank you.
Thank you. George, and you, Mr. Birdie will be followed by James Klein.
How are you? You know, I heard you all talk about the point-in-time survey, 2017. Something that's required by Housing and Urban Development. It's required every 2 years, and it's required so you can get Housing and Urban Development funds. I was very curious while I was up here that nobody mentioned the 2015-2016 audit, national audit that was done of the Department of Housing and Urban Development, in which $500 billion was missing. $500 billion. I thought that sounded big. I looked it up, and a lot of sites said it was fake news, but it turns out you can download the audit yourself, and there are $500 billion missing. My thinking is that one person does not steal $500 billion. But that probably a lot of different things were going on. And in fact, I was encouraged when I saw it because I'd been looking through our local HUD numbers, and they didn't look very good. Right now, what I've got is it's the annual financial report for the City of Santa Rosa Housing Authority. And it appears to have an audit at the beginning. If you look at the beginning, it says, oh yeah, look, this is an audit. But it turns out it's not actually an audit. It's a discreetly presented component unit of this. I thought that was lovely how they did that. So we're getting a lot of funds from HUD, and if you get past it, and you get down here, it says we do not express an opinion or provide any assurance on the information because the limited procedures do not provide us with sufficient evidence to express an opinion or provide any assurance. It also says that the introductory section has not been subjected to the auditing procedures applied in the audit of the basic financial statements, and accordingly, we do not express an opinion or provide any assurance on it. So the part of it that looks really great, we can't say whether or not that's true. And in fact, as you get into the actual financial, management's discussion and analysis of the financial statements, unaudited. So, and by the way, you don't have to be an accountant to look through these accounts. You just have to know how math works. Because, yeah, I understand what numbers are, and this is not right. Before we look at new things to do and working together, maybe we should check and balance a little bit and take a look at some of the audits, some of the things we already have in place that aren't working. Because somebody's stealing that money.
Thank you. James Klein. James Klein will be followed by Steve Bertolbo.
Thank you. I'm thankful to the council for being here and the county service staff, especially our police department. I think everybody should give them a big hand. They do more work than anybody else on this problem, and I know they do a lot of calls. I happen to live over on Sebastopol Road at a community behind Food Max. You know, last year I got with the city council on the problem over there. I don't see Sonoma County Parks here today. They've been a great resource for helping keep the trail cleared. But the one big problem is there's no place for the homeless to go. You know, I move them next door, then the police officer comes and moves them down another house and another house. They don't have anywhere to go. Let's get some land and make a camping area for them, okay? Let's do that. How much money is it going to take to turn a vacant lot into housing area for our homeless? And they're all our permanent, you know, residents. Let's do something for them besides giving them tickets and harassing them. Thank you. That's all I have to say.
Thank you. Mr. Bertolbo. Steve will be followed by Edward Meese.
Thank you, Mayor Corsi and members. Steve Bertolbo. I've been co-chair of Friends of the Homeless for about a dozen years, and we've heard providers come and talk to us month after month, I'm really glad to see that we're now talking about housing first. And I'm really glad to see all the county people with all the city people that are working on this issue in one room. As has been pointed out, we're missing some key county people. There needs to be a combination of county and city effort on this if we're going to build $160 million worth of housing for the mentally ill homeless, and then probably 5 times that much housing for the rest of the homeless. So let's look at what we do when we need to have a really strong staff and support for a city county operation. We have the Sonoma County Transportation Authority that takes care of our roads. We have the Waste Management Organization that takes care of our landfill. These are organizations that are probably the result of a JPA, and they're able to hire very well qualified staff that work closely with the staff for all of the cities and the county. And they seem to be able to avoid the problems that we've experienced with people not knowing what the right hand not knowing what the left hand is doing, and dealing with a situation that crosses boundaries. So as we look to a bond act for the county to take care of our housing problem, let's fix the leadership issue by creating something like SCTA or the Waste Management Authority. Thanks.
Thank you. Edward Meese, followed by Terry Mitchell.
Hi, I've heard some encouraging words about authorized camps, which are a good idea, and I am hoping that they will be secure and sanitary. Those are 2 things I wanted to get in about that. And also, I love the idea about working with nonprofits, because nonprofits are about the task at hand, and for-profits are about making a profit, and it's 2 different things. The one thing I would like to say about nonprofits is that you want to make sure that it is not one of those nonprofits that is a nonprofit but pays their executives exorbitant amounts of money. The other thing I wanted to talk about is that money. I never saw a homeless person growing up. There are some people as old as me in here, I think, that also didn't. Big tax cuts in the late 70s and 80s at the federal level and at the state level, and the state level is the only one we can do anything about, Proposition 13. I have been in touch with Mr. Levine and Mr. McGuire about repealing it with 3 exemptions. First, a person's primary residence, and that doesn't mean a castle, it means a primary residence. Second, a small California-based business would be able to exempt 1 property, and that also needs to be defined, what a small California-based business actually is. Oliver's fits, Food Max might, Safeway probably doesn't. And the third thing is anybody who rents their rentals below market rate gets a proportional cut in their taxes, their property taxes. And what I'm hoping I can get both the city council and the county supervisors to do is, now that we have a 2/3 Democratic majority in both houses and a Democratic governor, we might be able to start lobbying together the state government to make this kind of a repeal of Proposition 13 that would bring in a lot more money just in time.
Thank you. Terry Mitchell, followed by Joanna James.
Whoa. First of all, thank you everyone for your hard work on this issue. I know it's not an easy issue. I think a lot of organizations do a great job at helping the homeless people move into transitional housing and then permanent housing. So my question is, if we had houses for all of them, would they use them? Would they live in them? I don't know about that. And how many of the homeless use the services that are offered to them other than the food? Do they seek the the health services and the addiction services? I don't know. I don't know how you lead a horse to water. So I think we need to look at how we do that. Most of the people I see on the Bennett Valley encampment, because I drive by it every day, don't appear to be mentally ill. They appear to be camping there. And maybe I'm wrong, but they're taking in furniture, they're taking in, things to make fires, they're taking in propane tanks. So I don't think those are the mentally ill people. So my question would be, is there buy-in for them to obtain services and housing? If we provide them all housing with services, I understand they need them, is there something that they provide or they give back to that community so that they have a buy-in into the process? That would be one of my questions. The second one is looking at existing housing stock. I don't know what's happening with the Sinead, but there's Sinead. There's St. Rose Church, which I think there's one priest that lives in that complex. There's Holy Spirit Church. There's a big complex out there. The county that they're closing down the facility in Sonoma. I mean, can we look at leasing some of those facilities as opposed to trying to build brand new housing stock? Thank you.
Thank you. Johanna James, followed by Prudence Alasha.
Thank you, and thank you for having this meeting. I think it's obvious from all of these services that you're talking about that a great deal of coordination and collaboration is needed here. And I certainly subscribe to the idea that housing first is essential, but I'd like us not to lose sight of some more basic and immediate needs, one of which is access to toilet facilities. I just had the privilege of stepping out for a moment and going to a nice bathroom that wasn't even locked. As an aging female, I'm rapidly becoming an expert in the location of every toilet in Santa Rosa. But I'm appalled to find how many of them are locked. And all I have to do to get in is go ask for a key. Somebody will very gladly give me a key or tell me the code for the keypad. And almost always with this funny look on their face. There's somewhere between a grimace and a smile and a shrug as they say, sorry it's locked, you know, the homeless. And it puts me in mind of my childhood in the South, where there were separate toilets that were labeled for so-called colored. And so we had these, second-rate inferior facilities that were set aside for colored. We don't even manage that here for homeless people.
Prudence Alasha, followed by Adrian Lobby. Is Prudence here? Adrian will be followed by June Michaels. Is Adrian here? Hi. Okay.
Thank you. We lost a homeless person this week, Sandra Talbot Marsden. There's going to be a memorial for her June 7th, Wednesday, June 7th at the living room at 2:30. And there's been some definite, some stuff putting around about it, but she did die of natural causes. And she died outside, which is a shame. It's a shame on all of us, really. I would like to thank all the homeless people who are in the room and the people who are here who work directly with homeless people. Day after day, I see a lot of people, and I really appreciate that you're here. And if you aren't already planning to speak, I hope you will, because I think we hear what's available, and it sounds wonderful, and it sounds like there's so much, but I know that for homeless people, it's very, very hard to get what you need, and there are waiting lists for so much, as Ms. Combs mentioned. The problems are massive. We're not going to fix it overnight. I'm really glad to see you collaborating. I think having some bond measures to build housing is in our sights, and I hope that that continues. We have 40 encampments in the city that have been identified. I think that we should call those temporary housing, and we should thank the homeless people who build them. And we should provide them with porta potties and trash cans and the things they need to make it a decent place to be. And then I think we should really, in the next week or two, find some city land, find some county land where people can go. Because we now have a plan in the city, I've passed out information about this, to make infractions into misdemeanors that will be discriminatory against homeless people. We're gonna put them in jail. And jail is a lot more expensive than any other kind of shelter. We have people saying, you know, clean out Homeless Hill. Well, they're just gonna go to another place. So let's set this up, let's do it right. And let's save safe parking, please.
Thank you.
Thank you.
June Michaels. Ms. Michaels will be followed by Mandy Mars.
Hi, I want to say thank you to everyone who's participating. I have a question. I'm old enough to remember the Reagan days and how he closed a lot of outpatient mental services. Does anyone, city council or would the county remember the services that were provided before Reagan closed them? I don't know. Does that mean no one does?
I'm sorry, Ms. Michaels, we can't do a back and forth here at the public
Oh, I'm
comment
sorry.
time.
I just wanted to suggest that I don't remember, like someone else mentioned, there were not a lot of homeless before Reagan closed the outpatient mental services. Perhaps we could look at what was established before, what was successful before, because we don't have it since then. Also, I think bathrooms are a dignity. It's a right to have a bathroom. I highly suggest, as was mentioned before, putting bathrooms out. It could be around 4th Street as well. Could have certain ones, don't have to be porta potties. Empty buildings, we have those that could be transformed versus building new into housing. And regarding the police, for the homeless, I think there's better things that you can do besides shuffling them around. Thank you.
Thank you. Mandy Mars. She'll be followed by Leslie Allen. Is Mandy here? Leslie Allen? Leslie here. Oh. Leslie will be followed by Sandy Shotwell.
I don't speak nearly as poignantly as everybody else, and I feel ill-prepared, actually. But I'm here because I met Sandra Shotwell a year and a half ago, leaving my business about 11 o'clock at night on Farmers Lane. It was 30 degrees. It was January. And I looked down the breezeway, and I saw a person lying on their back on the concrete with their legs crossed and their hands on their chest, and that was Sandy. It's not Sand. She goes by Sand. And I just couldn't walk away. I knew I could call the police, and somebody would come and push her along or something. But I did do my best to provide shelter for her for about a year, and I wasn't able to any longer, so that came to an end. So I've had to basically put her back out on the street. But I've tried to maintain a relationship with her. And I guess some of the things I've asked her about, I asked her to come to this meeting today, and I said, what are some of the things that you could use right now? I mean, we obviously can't get everybody into a house right now. Some of the things she really struggles with. I mean, at one point I actually said something about, can't you just work at Taco Bell? You like to go to Taco Bell. They're hiring. And she didn't say anything at that time, but just the other day she said, how could I possibly work at Taco Bell? It's so traumatic trying to deal with the public, dealing with employees, dealing with a supervisor. It would be she's so traumatized from being on the street for 4 years. She flew her flag, she flew her sign on a corner out there to get money to buy a cart for her bicycle so she would have some secure place to put what little things she has, a clean set of clothes, some personal hygiene things. And that cart was recently stolen from her bike. And it is difficult for her to make reports to the police. I'm sure they're trying, but some of them are very rude and very unkind. And I'm sorry to say that, but I believe it. I've been treated that way myself. But I know she needs places to access the shower more easily and regularly. where she's not going to be hassled. She was arrested for trespassing at the JC for taking a shower. Thank you.
Thank you, Ms. Allen. Ms. Shotwell?
Thank you. I'm a native to the Bay Area. I was born in Marin. I've lived in Santa Rosa for 39 years. I'm going on 4 years being homeless. The cell phone has revolutionized homelessness, but it does need to be charged. It takes at least a couple hours to charge a phone, and a charge doesn't last a whole day. So now when you go home, you plug your phone in and charge it. It's charging while you're doing other stuff. I can't do that. I have to guard the phone because the number one difficult thing about being homeless is being ripped off by other homeless people. By far and away, it's so traumatizing that because of that, and because so many homeless people are mentally ill, and I have compassion for the mentally ill, I have compassion for the drug addicted, but such a large percentage of the homeless population is mentally ill that I no longer access the services available to me because it's just too traumatic to go to these breakfasts and dinners. There's always an incident, and the staff is overwhelmed, and they're not really qualified to deal with people that are mentally ill and drug addicted. So now I just don't even bother. Some suggestions, like what I would do to get out of the cold, you can go to, before FedEx, it's no longer 24 hours, but Kinko's FedEx used to be 24 hours, or you could go to the Jack in the Box diner, that's 24 hours, or you could join the 24-hour gym, that's 24 hours, but don't fall asleep. Sleeping is what makes being homeless a crime. It's not a crime to walk the streets at night. You can walk the streets all night long, but don't fall asleep, because that's where the crime is. Why can't you have a place that's like a combination of FedEx with little computer cubicles, like Starbucks with seats to charge your phone, like a 24-hour gym, but you're allowed to nod off without being asked to leave. Stealing a bike is a misdemeanor unless it's worth thousands of dollars. If someone breaks into your garage to steal your $300 bike, then that's breaking and entering. But if you're homeless, they don't have to break and enter. I've had 7 bikes stolen in 3 years, and now just the bike trailer was stolen. And before it was stolen, the bike and trailer was stolen twice, and it was stolen twice in a month, and twice I got it back, but now the bike trailer is stolen. It's gone. Stealing from a homeless person should be a felony. Stealing a bike from a homeless person should be a felony. Being brief isn't my strong suit, so my 2 minutes
Ms.
are probably...
Shotwell, we'll need to wrap up,
Yeah,
just
thanks.
if we can do it.
Have a great...
Thank you for telling us all your story. Victoria Fleming, followed by Susan Chunko. Susan Chunko? Is Susan here? She'll be followed by Michael O'Toole.
First, I wanted to thank Julie for addressing the difficulties one can have in accessing the available services. I work at Remembrance Village, which is more commonly known as Camp Michaela. We have our ups and downs. We also have water, some electricity, porta potties. It makes a huge difference for homeless people to have a safe place where they can access services that other people take for granted. I mean, toilets, water, electricity. We need more interim camps because we all know that housing first is at least a year or 2 in the future. We need something now, and we need sanctioned tent cities. Thank you.
Michael O'Toole, he'll be followed by Mandy P.
Good evening, Michael O'Toole. 107 days from now, Camp Michaela, also known as Remembrance Village, will be in existence for 2 years. We have done amazing things with Michaela. We currently have 7 people who are employed living there. I personally worked with 2 people yesterday to get them connected with mental health services. We do what other people should be doing. And we're not asking for anything for doing that. We do it because it's the human thing to do. What I would ask is after 2 years of existence, as Susan said, we've had our ups and downs. We need some assistance now. We're not talking about financial assistance. We need minimal sanctioning. We're not asking for 100% sanctioning. What we're asking for is for people to help us make this what it can be. It has been an amazing thing numerous times. It can be amazing again. We have problems, but it's hard. I work. I'm 60 years old. I'm doing everything I can. Susan, she works. She's doing everything she can. You know, these people need this space to get their lives back together. I mean, we have people there that really care. I mean, we have two people that work at Grocery Outlet. We have one person that works at Hyatt. We have another person that works at another really expensive hotel chain. You know, we have people that are really doing things. They're changing their lives. I'm helping a lady get SSI now. I'm plugging a person into the JC so she can go back to the JC and get an education and do what she wants to do. It's not that easy. You know, it takes a toll on a person. And I do it because I'm compassionate. Susan does it because she's compassionate. Adrienne Lobby does it because she's compassionate. We do this because it's compassionate, not because we're looking at the bottom line dollar we're getting. So please, help us. Engage us. Talk to us, please.
Thank you. Mandy P. Mandy will be followed by Sarah Hilton.
Hey, everybody. My name is Mandy. I also live at Remembrance Village. I'm kind of a new addition to it. Like Mike said, and Susan, we do have running.
Mandy, don't wander too far there from the microphone.
We do have access to water. We do have porta potties. We also have our own security. So as a way to maintain, everybody pretty much stays, you know, it's drug and alcohol free. Nobody is allowed to use or be addicted to that. The other thing is that we have our own council, like you all, where we have our set of rules. There's it's chores. There's stuff we're all expected to do something every day and not become a nuisance. The main thing is that it is a safe place where we can leave there to go do whatever we need to do during the daytime, whether it be like for a job, place to stay, anything like that. But we know we can walk away from those gates and we'll come back and everything will be there. That's very hard for a lot of people. I personally have had stuff taken from me. I've been off and on the streets over quite a few years, actually. It's been a challenge. I've battled depression, but every day I wake up not really knowing what the day's going to entail, but it's definitely an adventure. And it's one that I hope that y'all will realize that a lot of us take a lot of things for granted, like electricity, you know, your email, being able to email somebody, being able to pick up the phone and call somebody. You know, you don't know what you've got until it's gone. You know, I used to look at, oh God, I gotta go home now. When you don't have a home, it hits hard.
Thank you, Mandy. Sarah Hilton, followed by Kevin Conway. Is Sarah here? Kevin Conway. You'll be followed by Michelle Behrens.
Thank you, everybody. I'm Kevin Conway. I don't think my remarks represent duplication of effort. I hope not. But back in about 1990, there was a program called the Family Connection, and it was run by what I would call Saint Sister Teresita, who was with the Catholic Charities. But the idea was that community volunteers were placed in groups of about 4 or 5, and these groups then received training sessions at night, about 5 sessions about the goals of the program, and they were taught techniques for supporting a homeless family. Then the exciting thing was that each of these groups was assigned to a homeless family or a homeless person. We learned their history and their background, and then we got to meet them, and each of us took a very personal interest in this family. We did the kinds of things that Michael O'Toole referred to, helping them, the kids with their homework or driving people to medical appointments, helping them fill out forms and job applications, coaching them on being effective in a job interview, that sort of thing. And this was great because a concerned citizen could get involved in a very hands-on way as opposed to just giving money to very busy, overworked, and underfunded agencies. I don't know the statistic, but every day a significant number of us baby boomers turn 65, which means that they may be in a position, if they're retiring, to do this kind of service. There might be people in this room who would be interested in doing that kind of service to help out. So the template does exist for this kind of a program to get up and running, and I'd love to see that happen. Thank you.
Could you repeat the name of the program one more time?
It was called the Family Connection. It was done about 1990, 92, somewhere in that area. And Sister Teresita was the woman, the nun that ran that.
Great, thank you.
Michelle Behrens, she'll be followed by Georgia Berland. Is Michelle here? Georgia Berland. And Georgia will be followed by Leah Marks.
Thank you. I really appreciate your focusing on this subject as hard and long as you have, and doing it collaboratively with other jurisdictions and the public and with homeless people themselves. So thank you for that. And I hope the collaboration will continue to expand and include other cities as well. I think that was a very important suggestion. I want to just remind the council about some programs that are sponsored by much smaller organizations and some of the large public entities and large nonprofits, but that are extremely significant in terms of helping people get out of homelessness and that are having an impact on that. Two of these, the two that I'm involved with, are First Sober Sonoma, and that is one where we're reaching out to people who have been addicted on the streets for many years and moving those people into treatment. And someone earlier asked, do these people really want this kind of help? We were amazed at how many people are just coming to us and saying, please, can we get into your program? Bringing other homeless people, saying, this person's drinking too much, can you help him? We're only limited by the bed space that we have and the funding that we have. The people are really wanting this kind of service and are engaging with us to get it. The second program, and I want to say this program is fully funded through February at least of next year, and will probably be refunded based on avoided costs from the hospitals and other organizations that serve these people. The second program is Homeless Court, which proves to be extremely effective in getting people out of homelessness. We've resolved 188 cases in the first 4 sessions of that court, and helped 64 people resolve infractions, fines they've been carrying for things like illegal camping or a lost driver's license that has kept them from work and kept them from housing, and now they're able to access housing, and many of them are in fact now housed. So that program is still seeking funding for next year. It's a tiny amount of money we're talking about, between $25,000 and $30,000, to serve many, many people and really end their homelessness. So we're hoping that we can gather the support that we need to keep that going. But we thank you for all the work that all of you are doing to end homelessness. Thanks.
Thank you, Georgia. Leah Marks. And Ms. Marks will be followed by Nicolette LaFranchi.
Excuse me. I'm taller than this, sorry. Good evening. Thank you for taking all your time. So I'm here today to speak on behalf of all the parents and children with regard to some of the proposed tent encampments. Typically, these are on church-owned property. I've taken the time to read many of the reports, both here that have been presented by official reports for similar programs that were run here in California or other states. And one thing was resoundingly true for all of them, and that was that none of the encampments were located, regardless of the results, next to a school. And the proposed encampment on the lot, on the empty lot on the corner of Giffen and Stony Point Road is literally across the street from a K through 6 elementary school. And they're there for school and aftercare programs. And it just is a grave concern of mine that that's never been done before on a national scale, and we are considering testing it out in our community. And aside from that, my brother's a police officer, and I've spoken to some other officers about their experience with tent encampments and what they see. And I know, you guys are well aware about the policing and self-regulation, and they found that typically, because, you know, there's a zero tolerance policy as far as, you know, drugs and alcohol are concerned, the people who have these problems, which is, you know, that's a whole nother issue, they will just leave off campus and they will, or off of the encampment, and they'll go to the closest site that's available to them, that's, you know, not somebody's driveway or whatever, and it will be that school, and they'll do their drugs there. And just some food for thought. My daughter did a city-sponsored walking field trip today to clean up the creek, and in 15 minutes, they found 2 hypodermic needles and like 3 condoms, and it's in the creek. And having that be the place where people can just go and enjoy their time is really a grave concern.
Thank you, Ms.
Thank you.
Marks. Nicolette LaFranchi, followed by Peter Cherneff.
Hello, thank you for having this meeting. This is a question more for the, I guess, human health and services with probation and the No Place Like Home initiative that you're going to take. With these housing services for the mentally ill, I know that there must be standards that they must abide by to be eligible for the housing, but as you know, there is a large addiction problem with the mentally ill. So is there a way to allow them to stay in the housing while addressing their addiction problems? And if that's something that they can coordinate with probation as well? Thank you.
Thank you. And Ms. LaFranchi, we don't do it back and forth during this period of time, but we may be able to answer some questions after the public comment.
Okay, thank you.
Peter Cherneff, followed by Dorothy Freiberg.
Oh, what a wonderful crowd. Good evening. You know, back in the 90s, I was on the streets and I started a homeless mentor program with 2 homeless Navy vets. And the idea was to place them somewhere, make a deal with the hotels that are half empty, something. But the big deal is they would be doing a minimum of 20 hours a week, doing something beneficial to the city, like gardens or taking care of senior homes and cleaning things up. Simple things that we could all utilize. Yeah, and then Martin Luther King said he saw the promised land, which means technically we're all homeless. And he said if one man's wrongfully incarcerated, so are we all, so we're all in prison. And the boss carpenter said, as you do unto the least of me, which is the animals, you do unto me and yourselves, which explains our hapless mental illness that is so deep that you can't even acknowledge it. But maybe we're just waiting around for Jerry Brown's $2 billion to kick in for the mentally homeless and they get their train tickets to FEMA camps because that's already begun. Let's see. Oh, but for those that are homeless, like all of us, better still, this bitter pill, sign up today for the Homeless to the Promised Land Jamboree on June 9th. We're going to shut down the West Coast for the prophetic 40-day strike. It is going to happen. And I'll finish by saying that in this room there's such quiet, such stillness. In this room truly filled with mental illness. In this world that forever having sought to heist the power, the truth, and authority of Christ, serving 2 masters, de-escalating all disasters. June 9th, I'm here to report, begins the prophetic strike at the Oakland port. Ceasing the realm of mammon, so too Sataniel's backgammon, as we economically freeze-frame the entire West Coast till all DC's corruptions be dispatched as burnt toast, opening doors to the promised land for the true hearts. The true-hearted are the warriors, and the time be at hand. And I have some information here regarding that, so thank you very much,
Thank you.
Mayor.
Dorothy Freiberg, followed by Pamela Marks.
Good evening. Thank you for this. This is the second homeless summit I've been to, and I don't really see a lot coming out of them. Myself, I have been homeless off and on for 40 years. I raised my son on dirt. It took him 20 years, but he just graduated from Cal Poly, and he got a job in Santa Rosa for $55,000 starting salary. Go, Luke. Okay, one of our favorite sons, Jack London, was a homeless man in Oakland, California. He hung out in the library and wrote. And so, don't throw us all away. These are just kind of scattered thoughts. It is not okay to bulldoze homeless encampments. It is not okay. The people have a right to be secure in their homes, their families, and their persons and their possessions. And it's not okay to take that stuff away from people. I had a raccoon raid me, and only thing he could find to eat was the wax of the hearing aid ear, whatever these are. But I patched them together for this hearing. Okay, I want to thank the YWCA for housing abused women, families, the Redwood Gospel Mission for their massive work, and the Salvation Army for George's living room, or whatever drop-in center. Already?
Already.
All right. Thank you.
Thank you, Ms. Freiberg.
And
Pamela Marks.
no more meetings. Get working.
Is Pamela Marks here? Cecile Kerubin.
I want to thank everybody who's here too. I am currently a proud resident of Santa Rosa and of Sonoma County. I came from New York City where I lived most of my life. And in fact, I was a renter there. And so one of the reasons I got involved was because I'm still a renter. I saved my money other ways. But now, as I'm aging, it's scaring me a little bit about where I'm going to end up. So I decided I'd do something about it. I'm a CAB member of the City of Santa Rosa. I'm on the Housing for All. I'm the chair. And I also am part of a project called Homeless Talk. And I'm on the steering committee. And we held a series of 19 conversations about homelessness. And I hear people saying, like, stop talking. We've done all this talking. But I think it needs to happen all the time. And I think as a CAB member, I'll just tell you some of the themes that we're seeing because we're doing our report. And at any one time, there were 2 to 6 steering committee members. So we operated on self-funding. And some of the themes that we're hearing tonight are the themes that we're seeing, like the stigma and the biases and beliefs around homelessness that are just not true, but we don't have the proper information about it. Systemic issues that cause it. Other models. We heard a lot of people talking about other models that happen, things that happen in other cities. Mental illness and addiction, and we talked to a lot of people who are grappling with that. And we have a lot of solutions that came out of it. And some of them are maybe just ideas that will spark other people to think of better ideas. So I guess what I'm here to say is that we need to keep talking all the time, and I guess I'll stop. But we would like to present our report at some time to the collaborative group right here.
Thank you, Cecile. Thomas Els, followed by Cynthia Rowe.
Well, first I want to say thank you for having this event. This is an interesting thing. And thank you for everyone for staying. This is a ray of hope, and I want to offer back and reflect that hope. Supervisor Shirley Zane yesterday called for inclusionary zoning. This is a new thing. And in respect to the general plan update, the county is the lead agency for the general plan, like as for an EIR, under CEQA. It's a very important role. Under that Currently, the ABAG requirements for the 2015-2023 affordable component for the county is only 940 homes. For that 8-year period, they're only supposed to do approximately 940 homes, and it was previously 6,000 homes. So most of the housing in the future is going to be in the cities. That's just what we've done with the open space and everything. ABAG's 2040 requirement is approximately 33,000 homes for the county. This is going to require coordination of the general plan and requires significant coordination of the cities. But this requires the city to ask, because they're not going to come and tell you because of jurisdictional aspects. They could, they should. It's definitely required under the CEQA aspects of the general plan aspect. We need to coordinate this with the JC. I've said this community is a college town. Our housing and rents are significantly impacted by students. We need to have a study of that impact. How many students are living in houses not of their families? With inclusionary zoning, we need housing which satisfies the state's planning code to provide housing for every economic demographic in the community. And that, so instead of 20% or something like that, we need a little bit more. So this is not that difficult for a few houses, small numbers of the hundreds and thousands, but the tens of thousands of 33,000, that's going to not be that easy to do. But it's easy to do affordable housing for small numbers.
Thank you, Thomas. Cynthia Rowe, followed by Josh Silvers.
Hello, my name is Cynthia Rowe. I am a resident of the Southwest community, and I would like to talk about the CHAP program. I understand that that is a program for the future encampments that the council would like to place around the county. And before you put this into place, I would hope that you would look at some of the issues that could arise from this program. One would be affecting the property owners. The second one is the residents. And the third are the homeless that we are trying to help in the first place. In reading the CHAP program, I understand that there are certain things that the property owner is responsible for, and that is the hours of operation for that facility. Another thing that the property owners are responsible for is loitering, what to do if loitering should occur. I have reached out on a number of occasions to the facility that is looking in my neighborhood to put one of the pilot encampments in, and I have never received a response as to how they are going to deal with the issues. As a resident and listening to the homeless people up here speaking, we have the same concerns. They want to be kept in a safe environment. As a resident and a homeowner, I want to be in a safe environment. So I would hope that the council and the county, when you put out these programs, that you would have a single person in charge of the CHAP program who the property owners are accountable to, so that if there is an issue, that somebody in charge of the CHAP program can say, you're not adhering to the rules and regulations that we have, as well as making sure that the CHAP program is not across the street from schools. Thank you.
Thank you. Josh Silvers, followed by Celeste Austin.
Good evening, everybody. Thank you for having this forum. I really appreciate it. I'm a small business owner in Railroad Square. I've been there since 1999, and honestly, I've never seen it as bad as it is. And Chris, you and I talked about the numbers went down, but in our area, we have a lot of homeless services, but I've never seen camps under the, like actual tents under the freeways. And the police, bless their heart, they're trying. I mean, I know that I talk to them, and they amazingly won't go out there until they make sure they secure services to offer to the people. The last time when I talked to them, they went out there was 22 people in there, 4 of them were not eligible for services for having had issues, because people have issues, I understand that. But so that left 18 people, and out of all that, 6 people wanted services and they had 10 beds. So I love the fact that we spend a fortune trying to get all this together, but it's not working. I mean, I would encourage to think about the program at the Palms. I think is an amazing program. I donated a bunch of stuff there. It's a county, city, state, federal, all got together and really did something wonderful out there. I don't know if encampments are the thing, but something like that really seemed to work out well. And I would just also say that the encampments under the freeways, as a business owner, it's really difficult for us. I got young girls who, have to go out and they get hassled, and it's really an issue. I know there's not a lot you can do because it's a multifaceted solution. I know the police are really trying, I know you guys are trying, and there's a lot of issues to go with it, but programs that actually put people in rooms seem to be helpful. I'm done. Thank you.
Thank you, Josh. Celeste Austin.
Good evening. Last night, the Living Room program was invited to the Human Rights Commission, and we presented there for the commissioners and talked about our program as well as housing as a basic right and a basic need for all. Other basic needs and survival needs that you've heard individuals who are living with this challenge of being homeless, of some of the things that are just necessary to survive. I applaud everyone who is here at 10 minutes to 7 who is concerned and working on this issue. It's multifaceted, it's complicated, there are many moving parts, and as a service provider, I get to do service and work with people directly to try to make a small difference in their lives. The Living Room program, our executive director was here, our president of the board was here because we want to show up and let you know that we do care and that we're doing things to ease the adversity of homelessness. Whenever we can collaborate, it's always, I think, useful and helpful because we need each and every one of us to come together at different tables and to talk about solutions that are going to be beneficial to the individuals who are experiencing homelessness as well as to members of our community. Thank you.
Thank you, Ms. Austin. Xavier Nazario.
Good evening. I am on the Community Advisory Board for the City of Santa Rosa, and I felt compelled to speak up today, and I want to thank everyone who hung in there to the very end. The first thing I would like to make is just a recommendation. I'd love to see some public comment at the beginning of these meetings instead of the very end. We had a lot of interested people here that wanted to speak, and I think they for whatever reasons, had to leave before they had an opportunity to speak. The one idea, I don't have all the answers. I wish I did. But the one solution that I have, and I've mentioned it before, is every day I walk. I'm the director of University of San Francisco Santa Rosa campus, and I walk down Mendocino, I walk down College Avenue, and I pass these huge houses with 1 or 2 people working in them, whether they're law firms or other services, tax accountants, and they're these massive pieces of property with just a couple people working in them. And I'd love to see an initiative where we get those people into the vacant businesses that are in our business core and move families or subdivide those properties into homes to make it more affordable for people to live here. So I'd like to leave with that comment. Thank you.
Thank you. That's all the speaker cards I have. Council, are there any questions or comments at this point? Okay. So a couple of things have been mentioned tonight that I hope that we as a council can agree to pursue in the coming meetings. And I'd like to ask the council, first of all, to support me in inviting the Board of Supervisors at some point, I don't know whether it's the next meeting or a future meeting, but at the Board of Supervisors to join us around this table or another table that may be bigger than this. Can we agree on that? I see nodding heads. Thank you.
Do you need a motion or?
I don't think so. Yep. But thanks for asking. So I appreciate a lot of the comments that we've heard tonight, and obviously, you know, there are a lot of various interests. Some of those are competing interests. Some of those are seeking the same outcome but have different ways of getting there. It is a multifaceted problem that's going to take multifaceted solutions, and I think I heard both of those phrases used tonight. We obviously have a ways to go. We haven't solved this problem. I'm not sure that there's a community that has, but we are working hard on it. And with that, I'm going to ask for some suggestions for next steps and what our next meeting ought to be. I think that what I would encourage both of our staffs to do is to think about that question about how can we better collaborate, what do we need to do to that we're not already doing to create that collaboration. How can elected officials facilitate that, and whether that's coming together as elected officials or getting out of the way. I'm not sure what the answer is there, but I would like to have some feedback from the staff at the next meeting on those issues. And I'm open to suggestions on what else we can be talking about at that point. What are some reasonable goals? Yes, Mr. Rogers.
I'm not sure if at that meeting or at a subsequent meeting, but from the comments that I've heard from the public both tonight and prior, I think that it would be prudent for the council to have a conversation explicitly outlining what exactly is happening with encampments, what are the rules or regulations that are out there right now, what potential future direction is there, and give some clarity both to the misconceptions and the proper understanding of what is happening with encampments around the city. And I'm not sure if what the county is doing as well could be beneficial for us to listen to that as well.
Ms. Combs.
Thank you. I'm open to any conversation that talks about how it is that we come together and work together as municipalities, and how we effectively use the resources we have without duplication of services, how we make sure that the funding stream is going where we need it to go. I'm a strong advocate of the Housing First model, as I know my colleagues are, and I am really looking forward to how we do that with attention to the low barrier shelter concerns. You know, what are we doing for people who have partners, property, and it was 3 Ps, possessions, partners, and property, for making sure that those folks have available shelter sites. So how we come together around doing Housing First like Housing First is intended. I also have some concerns about how we're doing maintenance of persons who are homeless until they can be sheltered. And that may be the encampment conversation, but we clearly have maintenance issues with people who are not yet sheltered and for whom a bed is not yet available. And the list that I heard as people were talking were bathrooms, storage, charging a phone, and a safe place to sleep until there's a shelter bed available or something available. So how we're going to do that, whether, again, it's CHAP or something else, I think we need to have that conversation. I have some concern about some legal issues. I've been looking at Boise, I've been looking at Jones, I've been looking at a number of the legal issues around homelessness. I think that we need to inform the community as well regarding some of the legal issues. So I think it would be helpful to have some conversation around the legal issues. And again, we're, as a city, coming up on our funding cycle. I am hesitant to delay moving forward until after our funding cycle is over. So I'm looking for how we can piggyback some of the programs that we're funding on with the county, how we can get some of our RFPs out in time to get the funding that we need for a variety of programs, for many of our not-for-profits, done in time to include them in the current year's funding cycle.
Thank you.
That's my list.
Mr. Schwedel.
Thank you, Mr. Mayor. Mine's more, I was hoping for some more information, and it might be what was discussed prior to me getting to this meeting, but the shortfall in the ESG funding, do we have a dollar figure for that? I thought the gap is not 782,000 like the presentation. Mr. City Manager from Director Gwine.
That is the number.
For the city of Santa Rosa, we need to come up with 782,000 to cover the shortfall
No,
of ESG.
not for the city specifically.
So that's what I would like to know. Let me know what that figure is. How big is the net that we have to crack? And if we don't, what are the consequences to the services that we are currently providing? So that'd be one. The second one, I brought this one up to the expansion of a shelter capacity. What's that dollar figure, and how do we make sure that it's a housing-focused shelter, including what are the costs for housing navigators and for diversion programs? Those are some concrete things that we say, if we want this, there's this price tag attached to it. And regarding No Place Like Home, I would like to know, okay, for the city of Santa Rosa, if we're looking for shovel-ready projects, and I'm looking towards you, Mike, just presenting, what can we do as electeds? Do we need to locate projects? What can we actively do versus being said, I have no idea what other issues are being looked at that we could potentially be doing right now. If I heard December of 2017, it'll be a little bit more concrete. I've gone to two of Senator McGuire's presentations on this, so I have the concept, but again, working together, specific concrete things, what can we do to help that effort? And the last one is the single resident occupancies, SROs, similar to the Palms, because I know that's one of our housing action plans. What can we specifically be doing now, council electeds, looking at other locations similar to the Palms to convert to SROs? Because I know it's on our housing action plan, but does our staff have enough resources? Are there things the electeds can be doing with our resources to try to identify those locations to get the funding towards permanent supportive housing?
Thank you for those ideas. Any other comments, questions? The subject of encampments has been brought up several times tonight, and we have no sanctioned encampments that I know of in the city of Santa Rosa. We do have 40-some unsanctioned encampments that have been identified, and the council's been talking about these, the community has been talking about these for quite a while, and I know that we are looking at dealing with some of those, and I'd like to ask staff to talk about what those plans are at this point.
So yes, Mayor, briefly, the intention of a strategic plan to address the health and well-being of those experiencing homelessness, as well as the neighborhood that the unsanctioned encampments reside, is a program where we're trying to model what we do with currently with the SMART rail line and with the creeks and waterways, and that is in cooperation with the Homeless Outreach Service Team host, Santa Rosa Police Department, other professionals, is to actively engage those in those locations that we've identified as encampments that have 10 or more. We think there's at least 13 of those in the city of Santa Rosa. And invite folks into service. So the skill set is a diversion specialist. It's a person on the Catholic Charities staff that has a very intimate conversation with the person who is experiencing homelessness. Might we reconnect them to their support network? Is that a family? Is that a friend? Is that even a friend who has a vacant couch? Might we provide them with a hotel voucher just to secure them, get them used to perhaps enjoying a space around them and intensively engage them during that period of time? And then as well as the consideration of expanding our shelter network. The notion we have as staff is, City Council and counties currently support a 50-bed winter shelter. We could consider making that a year-round shelter and look at how we staff it and ramp up for a housing first engagement tool there. And then address the health and safety issues, the fire risk if there's high weeds, if there's sanitation issues, things of that nature. And so of the 13 encampments we've identified that have 10 or more residents currently, we're looking at addressing the first two, which the highest risk was on the spreadsheet we shared with the council. And that is the Farmers Lane extension and the underpasses of the 101 freeway. So that's a very brief overview of the pilot program we're suggesting we take some initial steps with.
Thank you. Any questions on that, Council? Ms. Combs?
I just wondered if you could clarify the document that we got said secure the location, and then it mentioned, as you have just mentioned, sanitation, health, fire safety issues. What is the proposed plan for how you're going to do those things? If you could just clarify, what do those things mean?
The secure the location means to address the fire and health risk. And so, for example, the Farmers Lane extension, it's been a very wet winter. The grasses are very high. They'll be turning brown soon. We just heard from speakers tonight, and we've observed ourselves that folks are, making campfires up there. They're propane cooking, and so addressing the fire hazard by abating weeds, clearing some brush up to 6 feet, for example, that would be an example of secure.
Thank you. And for the sanitation issues?
Right. So we've invited our partners to do an environmental health risk, and so depending on that risk, we would work with them to determine how we address that, whether it's removing trash, debris, things of that nature.
So all of this...
if I may?
Sure.
We want to address all of those also. We have been notified of some of the serious safety concerns, again, both for the residents and for the surrounding neighborhood. And so we do have liability concerns, and so we do want to move forward to address some of those critical safety concerns.
Is the plan to remove people, and is the plan to provide safe temporary shelter at that location, or is the plan to, I heard something about a hotel voucher, but previously we've had the number at that location down to 7. So how are you planning, if the plan is to remove people, what is the plan to enforce what the limit on the number of people who can be there is?
So again, we're going through a pilot program. Some of this is going to be discovered as we go through. The Farmers Lane extension, as was mentioned by the city attorney, has a whole slew of liability issues for the city, including the location and the safety of folks crossing to get to that location. Our desire would no longer to see that particular space occupied by anybody. But again, we weren't in a strategic process around that last year. We got down to 7, and all of a sudden the population went up. So again, I think what we're approach is the housing first model, but there are significant issues to that site that continue and especially the location, and that's why it rose to the top when we were looking at the vulnerability index for the folks in the location as well as to the surrounding community.
Is there a plan to find a city location that is an acceptable camping location while folks wait for housing?
As the mayor said, that currently there is not sanctioned encampment. There is not an attempt to pursue encampment areas in the city.
I heard you say there wasn't one, and then I heard you say there's not an interest or an intent to pursue?
That is against city ordinance as it stands right now, and then, you know, you obviously have asked for that conversation to move forward, but currently we would be then condoning breaking that particular ordinance.
So
if council wants to take action at a future meeting to give a different direction to staff, that's a different conversation. But right now, staff is not in the business of breaking ordinances without that direction.
Without council guidance. So one of the things I'd like to add to our future conversation list is recognizing an opportunity site, so that if we have to relocate people because it's an unsafe setting, and we don't have, and there's an and we don't have beds for people to go to, that we have a place where we can direct people.
And I believe, and correct me if I'm wrong, that the idea here is to offer an alternative to people living in these unsanctioned encampments. And those alternatives would range from, as Mr. Gwine said, a friend's couch, to shelter beds at Sam Jones that have been expanded to a year-round basis. You know, all of this is being done with the idea of the housing first model, but we're also talking about some serious shortfalls financially at the same time. So obviously we have challenges ahead, but in addition to talking, we are taking some steps here to try and address the issues that come up before we're able to meet here again. So the council is going to be needing to deal with that in the coming weeks. The Board of Supervisors is too. So I want to talk about a next meeting. And we've actually got a date that the council has agreed on that we all figured we could do, which is July 31st. That's after our budget process, and a lot will happen between now and then. I really appreciate the participation of county staff here, and I hope that you will be here again the next time we meet. I don't want to do that just to meet, though. If we need an interim meeting between now and when we get together with the Board of Supervisors, let's have that meeting. If we don't, let's not. You know, the next meeting could be with the Board of Supervisors. I'm going to ask the staffs, plural, to get together and figure out whether one or the other of those is the best way to proceed. And if the council has any better ideas, I'm open to suggestions. All right. With that, thank you, everyone, again, and we'll see you soon.